So good afternoon. It's still afternoon, right? Kind of early evening. And welcome to the 2025 Holistic Health and Wellness Forum for MS. My name is Mindy Eisenberg, and I am the director and founder of Yoga Moves MS. I'm so proud to be here with you today and provide a space for learning and connection. You are going to learn from an amazing panel of MS holistic experts. They brought together an amazing program for you so that you can be and live your best and healthy holistic life. For those of you who are not familiar with Yoga Moves MS, we are a community first and foremost. So whether you're together here in person, in Chicago, or you are online, we are together in community, and perhaps that's the most important thing that we do. So we are all connected. Yoga Moves MS is a nonprofit that provides adaptive yoga for people with MS and other neuromuscular conditions. We aim to be accessible to everybody and anyone. And so the services that we provide have absolutely no charge. Our second mission is to provide holistic health and wellness education to you. So with that, without further ado, I'd like to introduce Dr. Voci, who's the chair of Yoga Moves MS. He's going to say a few words before we get this program rolling.
Okay, so thank you, Mindy. Thank you, everyone, for being here. And so as Mindy said, I've been involved with Yoga Moves MS for, 10 to 15 years. I'm new to this area. I've only been in the Chicagoland area for the past 4 years, working out in the Evanston area. And I know you've come from all over the Chicagoland area. So thank you all. Trying to find a location that's globally accessible to everyone is not always easy. But anyway, thank you all for being here. I've been in the profession of medicine now over 4 decades, and I was there at a time when we didn't have any therapies for MS. So I am fortunate in that I knew what life was like before these wonderful new advances in medicine and in neurology for MS patients. It's been a great time to see such progress, but the medicines are only part of the circle that will be your journey with MS. To complete that circle, you have to put effort into helping your body, because MS does a great job of trying to attack the body. If you're going to be successful and complete that circle of your journey, you got to put effort into it. And when Mindy introduced me to her program of adaptive yoga for MS patients, that to me was the missing link to complete the circle of your MS journey. So I'd like you to watch this video. It's going to be from some of her students who have been involved with her for many years in the program. And listen, learn, and enjoy. Thank you.
Yoga Moves MS has somehow triggered something in me to care for myself even better.
I remember when I first started, I remember asking Mindy and the other classmates, how often do I have to do this yoga stuff? And one of the classmates said, every day.
Meeting once a week and having something to look forward to that's fun and accepting and energetic and compassionate. I look forward to it every week. This is like being on a team and going and seeing friends once a week.
The days that am practicing yoga, that evening, it carries through to the afternoon, to the evening, and to night, to sleep. I'm amazed at how everybody is understanding of each other. It's like meeting a group of friends.
Being in a place where we're not judging each other is fantastic, but I've had to actually come and learn through this class how to not judge myself.
I fell down the stairs, about 15 stairs, hitting my tailbone on each one when I was 11. That really mixed up everything as far as the lower body. Dancing, even though many times it was painful, kept me going. As long as you kept moving and kept going, it was fine.
I take it one step at a time. To come to yoga, Mindy and the rest of the group has taught me how to do things of that nature and just how to be very mindful.
It's another assistance, another guidance, another way to see the light again and not fall back into darkness. It's a jovial class.
Their strength, their determination, their wanting to help themselves, to feel better, that's what you find in a Yoga Moves student. You can see the light in our students' eyes, and you can feel it when you're around them.
You see other people struggling and getting ahead or gaining things they have lost, which is a miracle.
Seeing other success stories. We saw success stories today in class, and it was fantastic. And we see them every week. And even just today now, able to stand here in class, I surprised myself, and it was almost emotional knowing that my legs were underneath me. I'm not taking steps, but I'm able to actually stand, which I was unable to do 6 months ago.
Yoga has also helped me to live a stress-free life. I try to laugh as much as possible. I try to go as much as possible. I try to do as much as possible.
What is different about these classes is that they do take more resources to bring this class to the community. We have multiple teachers in a small group setting. And I'm so grateful for all that have been able to support the classes, our sponsors, our donors, our volunteers.
We are so grateful. And I have to say, for anybody that has any kind of neurodegenerative, any accident, come back to yoga. This Yoga Moves is the answer.
If I see anybody that look like they have multiple sclerosis, I tell them about Yoga Moves.
It's for all people with any ability, whether you can walk and stand, or if you're in a wheelchair. Every class has something that you can take with you.
You will stop losing mobility and flexibility.
Since we're on a fixed income, this wouldn't be available to a person of my status financially without the generosity of the people that support this movement. And for this, I am eternally thankful. And I feel it's a privilege to have an association with any one of the instructors. It's a blessing to find it. And I would tell somebody who's resistant the way I was that this is a no pain environment, and it's spiritual in its complexity and its integrity.
It opens up again your eyes so you don't close yourself in.
Given the resources that it takes to provide these classes with multiple teachers, anywhere from 3 to 5 teachers per class, we need support. We need support from our sponsors, our donors. We just couldn't do it without the support.
I'm not going to give up on things. MS may have taken my legs out, but you know, I still have beautiful things to look forward to.
I am here to fight.
The quality of the instructors is absolutely amazing. The acceptance is unconditional. That means a lot. And that's what was missing in my life. I now have a lifeline and motivation to continue and to bring out the best in myself.
So I want to add that our classes are online, don't have to be in person. So we also have a very active online virtual community. You can attend live classes. You can practice with recordings. And I believe there's even a yoga instructor from this area who is attending this evening. So we're always looking to bring classes to different areas. So keep that in mind. Maybe one of you watching out there or in here in person will want to take that on and grow our community even more. So we're so thrilled by the response today. We have our beautiful in-person attendance, and there's over 500 registered online. So welcome to all of you who I can't see or hear, but I know you're with us, and thank you so much for your interest. We pulled together some amazing speakers, and so just a few reminders as we move on. Our schedule is very tight. We're going to have some movement built into the program because I don't believe in staying still. So we're going to be moving. Feel free to take a restroom or a movement break. Do whatever you need to do and then come back to the program. The program is being recorded in addition to online. So if you miss something, don't worry about taking notes because you can go back to it and you'll be able to see the slides and the speakers. There's going to be 10 minutes for question and answers after each speaker. In person, people will be walking around and you can raise your hand. We'll bring a microphone over. For those of you online, put your questions in the chat. We will be collecting those and make sure to get to as many both online and in person as possible. We've tried to design this as an interactive program for you. This is a time you've got amazing experts at your disposal. So take advantage of it. The virtual exhibit hall, people ask, what's a virtual exhibit hall? If you're here in person, you were able to walk around and check out our wonderful sponsors and exhibitors today. Online, they have information on our website that you can get to. It's also in the program, and so you can use that QR code and it'll take you right there. Thank you to everybody that's here, both in person and online. I want to say a special thank you to Lori Svensson, who's in the corner in the purple, and thank you to Bill, who's helping make sure that really we have people from all over the world. Some of these countries I hadn't heard of before. So it's like, from where? From where? We still have to count from where everybody is, because it's really important to us. We feel like we're connecting you. We're connecting all of us together. Namaste to our amazing Yoga Moves instructors. Like I said, we want to build a team, and we do build a team. We have training online, and hey, you guys all over the world, like, we will come to you, no problem. Just tell us where to go. So namaste to our sponsors and exhibitors. There is no way to put on a program like this. I'm staring right at one of our top sponsors with TG. He's like looking the other way. Am I allowed to say your name or no? No, I'm not allowed. Okay, fine. Our top sponsor is TG Therapeutics. I won't say my connection. Yes, thank you so much. Like I said, this isn't possible without all of you. It really isn't. It takes, we all come together. So the second level is Biogen and Novartis. Thank you so much, Biogen and Novartis. I'm not allowed to look at them. They don't want to look at me. I don't know what the deal is. Level 3 are the exhibitors. Very important because everyone who's coming here today is trying to share information. You get to ask questions. It's really important to the people who are here that are bringing the information. They want to share it with you. So for those of you in person, you can go and talk to one of them at any point in time, or come to me and I'll tell you where to go to talk to them. So we have Alexion, Amgen, EMD Sereno, Genentech, and the Exercise Neuroscience Research Lab at the University of Illinois, Chicago. Yes. Thank you so much. Those of you who are in person, there's a special raffle, but see, we bribe you, so you have to stay to the end if you want to win. So let's take a moment and let's breathe in gratitude. Breathe in gratitude. Many of you might have heard, take a moment, like before you go to bed at night. It's a great practice. What's one thing that you're grateful for today? And it could be really, really something, like I got to have my favorite I got to drink out of my favorite glass today, right? Like whatever it might be, it doesn't have to be something humongous. Like I got to see this friend from across the world that I don't usually see. So take a moment and literally drink in gratitude. Breathe it in and then let it go. Breathe it out. And I want to take a moment to set the tone by, you might take your hands to your belly or not. Take a moment for breath awareness. Breath awareness. So with yoga and mindfulness, there's two things that help us come into our very being. And one of them is breath. We breathe in through the nose, of course, if you're not stuffy, right? And then breathe out through the nose. That helps to relax the nervous system. So notice at any point, you're seated, you're standing, you're lying down, in any position, you can bring yourself right back home. As you inhale, the belly expands, and as you exhale, it softens back down. And with yoga, we play with the breath in so many different ways, but this simple breath of awareness is so very powerful. So it just helps you anchor in, like, I'm here, I'm in this body. Take a moment, feel your seat, feel your body touching wherever you are right now in this moment. So I have so much gratitude for all of you today. And without further ado, I'd like to introduce Dr. James Voci, our first speaker. He received his undergraduate training at Haverford College in Philadelphia, followed by medical school at the University of Pennsylvania. There, his interest in neurology was nurtured by a very strong faculty. They were very convincing. His residency in neurology was performed at the University Hospitals of Cleveland Case Western Reserve University, where he served as chief resident in his final year. Upon completion of his training, he served on the faculty there as assistant professor of neurology, performing both research in molecular biology as well as instruction of new residents. From 1996 to 2020, he was in private practice in Cleveland and Detroit. And I have to say, I'm from Detroit, was very lucky to have him there. Now Chicago's really lucky. You guys stole him and the whole family. Just adding that into your bio. Dr. Voci currently serves as the director of neurology at St. Francis Hospital in Evanston. He's actively involved in the care of MS patients, both clinically and with clinical research studies. And yes, he actively practices yoga. He's been the chair of Yoga Moves MS for over a decade. I was counting that going, wow. Thank you so
Mindy.
much.
Oh, yes, thank you all for being here. And I promised Mindy I would keep this very brief because I'm not noted for my brevity, but as soon as the slides get up, I'm just going to do kind of a brief introduction as to about MS and where we started, where we're going. So it'll be kind of just a brief summary. All right, so just to refresh everyone's memory, MS is considered a chronic immune-mediated disease of the central nervous system. So it's an autoimmune disorder. Any part of the body can get an autoimmune attack. So in rheumatoid arthritis patients, it's your joints. Crohn's disease, it's your gut. Psoriasis, the skin. But with MS, it's the brain. And it specifically attacks what we call the myelin, which is the insulation that helps the signals move from one part of the brain to the next. So it disrupts that communication. You guys are not alone. This is a very common disorder worldwide. Typically gets folks in their youth. Most autoimmune diseases are more common in women than men, but men still get MS. And even though it's most common in youth, we occasionally diagnose people in their sixth and even seventh decade. So these are just some typical MRI pictures. On the left, you see the dark structures in the center. These are your fluid ventricles. That's normal. Here's your brain. all these white spots are areas of scarring or inflammation. So the term multiple sclerosis is multiple scars, and that's what those white spots are. It's another version next to it, and this is a lesion in the spinal cord of a patient. You can see a little white splotch there and up there. The current recommendations from the consortium of MS centers is that you folks really should be getting imaged once a year with your brain to keep your brain in a surveillance monitoring. The cervical spine also needs to be imaged at some point early on in your diagnosis and then periodically thereafter. As you probably know, sometimes lesions happen, but they don't cause you any symptoms. But to us, it still means it's active disease, and that's why the surveillance monitoring is important. All right, so there's been a lot of progress, as I said, in the 40 plus years I've been doing this. We know that there are multiple pathways that can happen to the immune system to trigger MS. Back 5 decades when I was in college, the immune system was, our immunology book was a very thin paperback. Now it's much more complicated than that. So it's, there's T cells, B cells, antibodies, all these things play a role. And we're learning more and more about how these roles interact with each other. You don't inherit MS. So, our kids blame us for many things. They can't blame you for giving them MS. But what we pass on is complicated immune genetics that may increase one's role towards getting an autoimmune disease of any type, depending upon what environmental exposures you may get exposed to during your early years. Some of the environmental issues will include low vitamin D levels, smoking, and viruses. You're going to hear a lot today about the immune role of the gut and the GI tract. Your stomach tract is the largest immune organ in the body. And we're now understanding we got to pay more attention to what goes on in our gut. We now have more improved imaging and biomarkers as well. So again, things are getting much more sophisticated for you. On the left is what a healthy nerve cell looks like. Those sausage-like structures are the insulation, the myelin sheath. So if you ever have run over your electrical cord vacuuming and you strip the insulation off your electrical cord, the signal weakens and your vacuum may shut down. The same thing happens here. The antibodies start attacking the insulation and signals don't propagate normally or don't propagate at all. All right, some of the newer advances. We have, when I was starting, MRI scans were just coming out in the early 80s. And, when you looked at a CAT scan and then compared it to what you saw in an MRI scan, it was almost frightening because we were realizing how much we missed because CAT scans just weren't sensitive. There's also new AI programs for reading MRI scans. Rush has that technology from Icometrics. Stunningly amazing. It's much better than what a human can read. So things are getting better. It's getting more sophisticated for us. There's optical coherence tomography, a type of CAT scan that looks at the retinal layer. They're working on new blood and spinal fluid biomarkers. The whole point is that earlier diagnosis means earlier treatment, and that ultimately for you means better outcomes. All right, so as I said, I was around when there were no treatments. We now have close to 30 treatments for MS. The goal of these things is to slow the disease process, prevent relapses, and preserving your function. Because we have many options now, we can more personalize your treatment regimen. It's not, one size fits all. We can actually adapt it based upon your lifestyle, your preferences for how you want to get medications, how frequently you want to get it, and the mechanism of delivery of immune protection. And a growing concept, which is still being worked on, is what we call immune senescence. Again, when I started, it was great. We got people on medications, but, then we realized now 30 years later, well, how long do you keep treating people to modify or suppress the immune system? Do you do it forever? Because as we get older, we need our immune system more to fight things like cancer and infections, which increase as we get older. So the question is, what do we do with immunotherapy in you folks as you enter your 6th and 7th decade? for some people, we may have to take you off medication, given your history and what your medical history is. But so there's a lot of thought is going into this, and this is a huge topic that is still being worked on. So more of that to come. What we have with our newer disease therapies, the B-cell therapy class right now is probably the most actively used. It includes drugs like Ocrevus, Kesimpta, and Briumvi, probably now considered the most effective class of agents. They target the B cells. There are also, though, oral medications that have the convenience of oral administration and efficacy. There are two medicines, cladribine and alemtuzumab, that are called immune reset therapies. These are short course therapies that hopefully can have a durable long-term effect. Work's still being done. The good news is a lot of research is being done, and you need to make sure you tell your Congress people not to hold up research funding for political reasons. Research funding benefits everyone regardless of political party. Research funding should never be held hostage for any other reason. So it's important. Speak out to your Congress people about this. The newest class of drug being studied are the BTK inhibitors, or the Bruton's tyrosine kinase inhibitor. They're making their way through their clinical studies. We're eager to see that. There's also a thing called CAR T-cell therapy, which is chimeric antigen receptor therapy. It's where you modify white cells. This is used heavily in cancer treatment, also now being introduced into the MS arena, still in clinical trials. But again, the trend is we are developing highly effective, targeted, safer therapies for you. Symptom management is important. Fatigue is a huge component of MS. You guys out there with MS know that. There are certain medications, modafinil is one of the most actively used, but exercise and mindfulness therapies. Minnie was showing you the breathing exercises. A great mindful practice, just slowing down, taking some deep, slow breaths. Mobility, as I said earlier on, the medicines can only do so much. You got to complete that circle, and that's where the physical adaptive programs come in. So work heavily with your physical therapy people. There's even things being done called functional electrical stimulation. And of course, we heavily support adaptive yoga and even Pilates as a way to help keep your muscles from becoming too stiff and spastic. A lot of the patients you see in Minnie's class, they're able to get off their muscle relaxants just from doing these exercises. And that's a good thing. Your liver will be happy it's not seeing so many pills in it. Cognitive issues are also, a concern. Cognitive training tools are being worked on. So basically, there's an integration of neuro rehab issues and technology that are trying to help you with symptom management. Lifestyle issues, we're going to hear more about the dietary concerns. The American diet is not a great diet. We really need to focus on a more anti-inflammatory diet. Exercise, we talked about. Vitamin D levels play a role with the immune system, and all of us in the Great Lakes area, we will have no sunlight from November till, the end of March. So our vitamin D levels plummet. Make sure you get your vitamin D levels checked. The important supplement in vitamin D is vitamin D3. That's the one you want to focus on. And mental health is important. MS can be a depressing illness. If you are struggling with this, seek out help. But also remember, things like mindfulness and practices like adaptive yoga can also help you with your mood and become a member of a support group. I know there's members of the MS support group here today. There's help in numbers, right? So join your partners in crime here and learn from them. You become a team. All right, new research horizons are remyelination therapies, different neuroprotective therapies, stem cell therapies, gut microbiome research, digital monitoring apps. So there's a lot being done. This is a very, very good time for you folks because there is a lot of good progress. So again, earlier diagnosis, better therapies mean better long-term outcomes. MS is not the dreaded disease it was half a century ago. You can live a normal life expectancy and hopefully preserve a lot of independence. It's going to take more effort, right? Of course, but you can achieve this. And again, the goals have shifted from not just slowing the disease, but preserving your brain health and your quality of life. So again, tremendous progress in the past quarter century, great new treatments. And I want to also thank, as Mindy did, our sponsors. We wouldn't be here today if it weren't for the research and efforts they put into this progress. So things are looking good for the future. Was that 5 minutes? Okay. We're ready to go then? Okay.
Right now. Questions for Dr. Bochy? I'll come around.
Yeah, if not, though, I'll be here the whole time. Yes, sir. Yeah. Okay. The question is vitamin D3 pill form. Yes. In general, the standard recommended amount is 2,000 units a day. Now, there is a hypersupplementation of 50,000 units. And yes, you can do that if you're really, really low, but that should be done once a week for 8 weeks. Then you take a break and go on the lower supplementation. All oral. Yeah.
Any other questions?
Okay, all right. So Mindy has given me the pleasure of introducing our three speakers. Our first is Dr. Thomas Holland, who has expertise in general acute care, clinical knowledge, and lifestyle medicine, which includes topics on nutrition, physical activity, and cognitive activities. He's done much in the area of aging research, specifically related to neurodegenerative diseases like Alzheimer's diseases and other dementias, as well as cardiovascular disease, oncology, and other chronic diseases of aging. Dr. Holland's newest area of interest includes pharmacoepidemiology and best practices for implementing lifestyle modifications in the primary care setting and in the community to help improve public health. Tonight, Dr. Holland's going to speak to us on the topic of eating for your brain, the role of nutrition, and the gut microbiome in MS. So, Dr. Holland, we are so pleased you are here tonight. Thank you.
Thank you. All right. So first and foremost, thank you, Mindy and Yoga Moves MS for having me here. I'm super excited to be talking about this. So as Dr. Bochy said, I've been doing research in diet in particular, but now recently for the last 5 years about lifestyle interventions, specifically for brain health. And a couple of years ago, Dr. Augusta Mirabale approached me about getting involved with multiple sclerosis. And as we think about the impact of neurodegenerative diseases, lifestyle becomes quite paramount. And we want to think about a marriage of the allopathic kind of medication route, as well as the lifestyle interventions, specifically to optimize the overall health. So today I'm going to be focusing on nutrition and the role of microbiome, but I'm also going to branch into other lifestyle factors because fortunately we just had a huge national trial round out in July, and we had our final results published. So really fun stuff there. All right, no conflicts. Food being your medicine. This has been a theory for a very long time. And as research has advanced, we really start understanding what exactly food does for us. My mentor and one of my current PIs was the inventor of the MIND diet, which is the Mediterranean and DASH intervention for neurodegenerative delay. Ah, yes. All right. Is it very loud? It's perfect. Wonderful. All right. So as our research advances, we start understanding how lifestyle really works together. And for me, my difficulty has always been diet. I was raised very meat and potatoes. And so understanding what I need to do to modify and simplify my intake has been very important to me. And also, as I've started to understand how all these other research components come into play, what I eat impacts my microbiome. My microbiome, okay, it sounds so velvety. So what we eat is impacting our microbiome, and our microbiome impacts how we digest different foods. So that's what we're going to be getting in today. So I'll briefly touch on our MS and neuroinflammation since Dr. Voci did such a phenomenal job on that. We're going to go over a little bit on the global and US prevalence, but I want to also talk about the Alzheimer's side of things, because when we think about neurodegenerative diseases, and especially inflammatory processes, it starts to become very important that we think about our brain health, not just the functional side of things, and especially as we are aging. We'll get into the gut-brain axis, as well as key nutrients and dietary patterns that have been developed. And then we'll go over briefly some of these lifestyle factors that some of my colleagues will be delving into a bit deeper today. All right, so Alzheimer's, we've got 55 million people worldwide. It's anticipated to triple by 2050. And we've got about 7 million in the US. And then on the MS side, now we have 2.8 globally and 1 million in the US. As Dr. Voci said, we tend to see this in younger individuals, especially women, and we are starting to see this a bit more in industrialized and developing countries. And so when we think about the advancement of our care, and especially what we're doing earlier on in our lives, we need to start thinking about how we're living our younger lives that are going to inform how we live our later lives. And then certainly prevention is going to be huge. When we think about these combinations of disease processes, and in my world, dementias, and we think about mixed pathologies, prevention is a very, very important side of this. If we can prevent vascular dementia, we can prevent later outcomes. If we can prevent the onset or slow the rate of cognitive decline, we start seeing how people can start becoming superagers. So again, for MS, autoimmune. And the big component here that I want to hit on is that autoimmune and neuroinflammation component. The big aspect here is that if somebody is doing activities that are going to cause inflammation, then we're priming ourselves to have either more frequent or longer duration of flares. And so the idea of implementing appropriate nutrition and lifestyle factors is to diminish the duration of a flare or mitigate it altogether. And one big aspect that we want to do is, again, shorten it, and if we can, stop it altogether. Now, I'm going to go into some specifics later on, but big lifestyle factors that are obviously being studied are going to be lifestyle behaviors that are modulating the inflammatory process. So inflammation in the immune system is appropriate. We need that in our bodies. But what can happen sometimes is that when we have inflammation in our bodies, there can either be a longer duration, so chronicity of it, or we can have a higher amplitude. Both of those factors can cause damage to neural tissue or damage to the myelin sheath and cause a flare. And so when we think about the dietary components or lifestyle aspects, what we're really wanting to do is cause immunomodulation. We're wanting to shorten that. We're wanting to make sure that the immune system functions appropriately, but isn't overly active in causing damage. We also have exercise, which can help with increasing brain-derived neurotrophic factor, which is a thing to help our brains and neural tissue. We also have sleep and stress regulation, and I'm going to go over very specific components of that later. And then social engagement. One big aspect, and this is a huge component, is loneliness. And again, I'll talk about that once we get to some of these very specific components in a bit. So the gut-brain axis. The gut and the brain are going to communicate via nerves, the immune system, and the endocrine system. Everything's going to be connected. When we think about the microbes that are functioning, they can act as neurotransmitters and as metabolites. And the vagus nerve itself, which is going to be cranial nerve 10, is actually going to help transmit signals from the gut to the brain. And the GI tract itself is usually thought of as the little brain. It has all of these various reflexes that allow it to prep for food coming in, allow it to get ready for food to be digested, and how we're actually going to be storing and extracting those nutrients appropriately. Dysbiosis, which is a disruption of your microbiome, can disrupt your immune system. And so maintaining appropriate microbiome, and by that we mean intaking appropriate foods, is going to be important for helping the microbiome grow. And as this says, stress and diet can actually reshape our microbiome. So the microbiome itself is set up to process the foods that you intake. Our microbiome can actually start modifying within about 24 hours of a diet change, but it takes about a month to actually change fully. And if we think about what we're consuming, if we're consuming high-fat meals that are going to be processed, the microbiome is going to modify to be able to process those high-fat foods. So think high-fat red meat or high-fat dairy, butter, things like that. Well, if we're intaking dark leafy greens and berries and things that have a bit more fiber, our gut microbiome has to modify to be able to digest that and extract the appropriate nutrients. And so we need to give our bodies time, the way we would with exercise, to make that modification and make sure that it's appropriate and able to actually digest the foods that we want. One thing that I always talk with participants of studies about is as you're modifying, you may experience a gut upset. You may have gas, bloating, diarrhea. And a lot of people will attribute that to potentially bad food. But what it actually is that your body may not be processing the foods that are coming in. So if I go from eating dark leafy greens and berries and fish and lean meats to then all of a sudden having a 70-30 burger, well, that's a lot of fat, right? It's a lot that my body is not going to be able to process. And that's going to make its way through the entire bowel. And you're going to be like, oh my gosh, I must have had bad meat. But it may not have been that. It could have been just that your microbiome isn't primed to process those foods. And it works both ways. So making sure that you give your body time to change is important. So microbiome and MS, certain microbes can actually trigger MS in genetically at-risk individuals. So being cognizant that what we're intaking and how we're intaking is important. There is potentially going to be a reduced diversity of these microbiome. We want to make sure that we have appropriate gut bacteria that can digest these things. But when individuals have disease processes, there can be this dysbiosis or a change in that gut microbiome. And we especially see that in MS individuals. We typically see a reduction in this bifidobacterium and lactobacillus with an increase in Akkermansia and disulfovibrio. And then a lot of people have been talking about this twin studies with the mice and determining that there was a difference in the microbiome and that we also saw a damage to the CNS in the group that had the poorer microbiome. So again, these are mouse models, but it can inform how we think about what is happening in humans. And certainly we would anticipate moving this research forward. Healthy microbes are going to be protective. And then on the other side of that, because microbiome is modifiable, it can be both a risk and also a therapeutic target. So gut permeability and neuroinflammation, leaky gut can lead to bacterial toxins entering the circulation. If we don't have the appropriate gut bacteria and we aren't taking care of our GI tract, the ability for toxins to get into circulation is higher. We can have increased systemic inflammation and blood-brain barrier disruption, meaning that if we have more systemic circulation because of the foods that we're intaking, then we are priming ourselves for some type of inflammatory process. And we also promote microglial activation and myelin damage. So microglia are going to be white blood cells in the brain. And if those are overactive, it can cause damage to that neural tissue. And as we said, damage that myelin sheath and then disrupt things. We want to make sure that we're intaking fiber, omega-3s, polyphenols that are going to help to restore the integrity of the nervous system. And then diet, as we'll talk about, is going to directly impact your immune system. So fiber, short-chain fatty acids, these are going to help regulate T cells and immune tolerance. And when we're talking about fiber, short-chain fatty acids, we want to think about, again, omega-3s in particular, but also omega-6s. Omega-3s are going to be in your fish, so dark fatty fish in particular. Omega-6s are going to be a lot of your seed oils. So that's going to be your avocado oil, olive oil, whole grains. And those omega-3s can modulate the cytokine and the membrane fluidity. And what that means is that we allow for appropriate functionality of the cells to occur. And if that's disrupted, then again, we can see damage and inflammation. Polyphenols, which is an area that I've been working on for about a decade, are bioactive. So these are going to be a lot of flavonoids. And these are going to be seen in fruits and vegetables. Big concentration are dark greens, berries, so especially blueberries, strawberries, raspberries. We also see this in our cherries, olive oil, various types of fruits and vegetables. But really, the dark leafy greens and berries have a very high concentration of these. As it says, diet composition is going to drive our immunity, and whole dietary patterns outperform supplementation. Point being there is that you can intake a supplement, but that supplement's going to have what the label has. Whereas if you're intaking a salad that has dark leafy greens, olive oil, say for instance you throw in some pickled onion and some other components there, and with fish, all of a sudden your intake, your overabundance, so you have this diversity of nutrients, and it's a diverse quantity and quality of nutrients. So our dietary patterns, as I said, the MIND diet is the Mediterranean and DASH intervention for neurodegenerative delay. It's a mouthful. The reason I like it, first and foremost, I'm super biased because my mentor developed it, but also it's easy. It's 14 points. There's 9 that are things to increase your intake and 5 to decrease intake. And I'll talk about those a little bit. The emphasis of this diet was plants, legumes, whole grains, fish, and olive oil, getting your lean meats. The 5 to avoid are going to be your high-fat dairy, red meat, baked goods, fried fast food, and also butter. This diet was associated with having a brain age of about 7.5 years younger than individuals that had a lower diet. So on the scale, if somebody was at about a 13, they were 7.5 years younger in brain age than somebody that was at about a 7. Lower risk for dementia as well as MS progression. And also one of my colleagues, Dr. Pooja Agarwal, did a study that showed if you're consuming good and bad at the same time, it can actually attenuate or stop the beneficial effects. So when we think about that side of things, you're saying if you were to split a year in half and you eat well 1/2 of the year and poorly 1/2 of the year, you're a +1 and a -1. You're getting a 0. So what you want to do is try to eat well a majority of the time. Key nutrients, as we said, omega-3s, vitamin D, polyphenols. B vitamins are going to be really, really big in helping with energy and methylation. Fiber is going to be immensely helpful as well. And we'll talk about fiber from a prebiotic perspective. So pre and probiotics. Probiotics are going to be live beneficial microbes. And we see this in fermented foods. So think of your kimchi, your pickled onion. My favorite personally is kombucha. And I like to do kombucha with some lime and ginger. When you think about kombucha, we were just discussing earlier, you go through Whole Foods and you're like, oh my gosh, kombucha, it's crazy expensive. And it is if you're buying single bottles from Whole Foods. And they got a lot of really good flavors. But I like to go to Costco. You can get, I think it's a pack of 18 for about $25, something like that. And so it makes it easier to get in. And they have high volume of colony forming units. And that's what you're wanting to look for. Our prebiotics are going to be setting up the environment for good bacterial growth. So this is going to be foods like garlic, various types of fiber. You can think about it from a supplemental perspective like Metamucil, but getting your dark leafy greens is also going to be incorporating that fiber as well. And we also have symbiotics. So combining both for the synergy. Being able to intake your prebiotics that set up the environment and your probiotics, kefir, yogurt, fermented foods, kombucha, it allows the bacterial growth to occur, and it sets up that environment to where it's going to allow the good bacteria to take over. And early trials have certainly shown improved fatigue and inflammatory markers in MS. Physical activity and sleep and stress. So as we said before, exercise can increase BDNF and enhance neuroplasticity. It improves vascular health and metabolic health. When we think about sleep, we really want to make sure that we're getting 7 to 8 hours of sleep per night. It helps with washout and cleaning our brain, but it also helps with restorative components. Now, stress. All of us have a lot of stress. No matter how you cut it, there's going to be stress. But stress is going to increase cortisol, and we're also going to see an increase in inflammation. So trying to figure out what you can do to diminish that stress. If you have a stressful incident, what do you do to have that mindfulness, bring you back to center? And figuring out what works for you is very important. Mind-body practices also reduce immune dysregulation. So just being cognizant about how you're living your day can help with reduction of that inflammation. So lifestyle and brain health. So this is a big study that we just finished in July. We had over 2,100 people at 5 different sites in the nation, and we had a multi-domain lifestyle intervention. So it was diet, physical activity, cognitive activity, and socialization. There was this big focus on ensuring that people adhered to these different interventions to help them improve their cognition. And what we found across a 2-year trial was that individuals had a brain age of 1 to 2 years less, meaning that it slowed or effectively stopped the rate of cognitive decline, which is really, really exciting in our current state. So this is real world proof that lifestyle does work. I had the opportunity to see individuals' labs every 6 months across a 2-year time span, and we're now 2 years into the extension. So I'm able to see how the maintenance has occurred. And what we saw was reduction in LDL cholesterol, the cholesterol that causes blockages in the vessels. We saw an increase in HDL, better glycemic index control, weight loss, and overall better mood. So I want to get into some of these definitions, and this is something that Dr. Miravale, I believe, will discuss as well a little bit, but I want to briefly touch on it because it's important to think about these components. So cognitive reserve and lifestyle. Cognitive reserve itself is going to be kind of a buffer to the damage, whereas our cognitive resilience is going to be the ability to bounce back in the face of damage. So think about somebody that has a stroke or they have a multiple sclerosis flare. The ability to bounce back in the face of injury is really important, and maintaining these lifestyle factors helps us with that bounce back. And there's also neuroplasticity, and neuroplasticity is the ability to rewire and adapt. So as we think about how we're living our lives, we want to make sure that we're challenging ourselves. And so tying it together, our cognitive reserve is our ability to withstand the damage, so buffer against it. Our resilience is our ability to bounce back, and our neuroplasticity is our ability to adapt. So practical lifestyle recommendations. You know, we were talking earlier in the aspect of telling somebody, hey, do physical activity. In my opinion, that's unhelpful. As Dr. Voci said, you want to start thinking about being precise, having precision medicine in how you approach these things. For our trial, we had 120 to 150 minutes of moderate to vigorous physical activity. And that was broken up into 5 30-minute bouts. And that was to help with the vascular health as well as the neurovascular health. 7 to 8 hours of sleep nightly, managing the stress, staying socially and cognitively engaged, and obviously implementing diet. So the cognitive engagement, you want to make sure that you're doing something novel. Okay. You want to make sure that you're doing things that are novel to you. Big things would be learning a new instrument, learning a language. We know that individuals that are bilingual have slower rates of cognitive decline over their lifetime. The big thing that I like to do is implementing little things in my life. So I try to brush my teeth with my left hand. I hate it, but it makes me think in a different way. When I go to the gym, I go and pick up a weight with one hand and I put it back with the other hand. So these little things cause me to work harder. One aspect that I always talked about with our participants was taking classes at the community college. There's a lot of open availability and variability in those classes, but the whole point is to stay engaged. Now, for the social aspect, the big thing is where somebody is lonely and feels alone. Or sorry, is alone and feels lonely. So somebody can be introverted or extroverted, and that's perfectly fine. But when somebody wants to be around people and they don't have the opportunity to be around people, that's where there's a very high risk category. And those individuals actually have a impact on their mortality of about a 15-pack year smoking history. So again, making sure that we're staying socially engaged is important. One big thing I've been really getting into lately as well, there's a Netflix show called Blue Zones, and they go to Okinawa for one of the first episodes. And one of the theories is Ikigai. And Ikigai is a purpose of life. So this is a meaning. This is a reason why you get up and live your day. And this is one thing that I've been really trying to implement in my own life, in recognizing why I do what I do and what my purpose in life is. And what we know is that having a purpose to your life, a purpose to get up and live your day, is associated with longer life, and it's associated with better brain health over time. So future directions and collaborative care. Fortunately, again, I've had the opportunity to work with Dr. Miravalle and see the team that he set up. Having personalized nutrition based on microbiome profiles is a direction we can go. Using wearables to track your activity, integrating these different lifestyle practices is important. And then obviously longitudinal research to see how these are impacting individuals over time. Multidisciplinary teams where you have multiple experts in the room taking care of a singular person really helps drive the precision aspect of medicine. So having your neurologist, dietitian, physical therapist, mental health providers, all of it is going to help tie it together. So at the end of the day, health is a lifelong journey and every step counts. No matter your age, it's never too early or too late to start making positive changes to benefit your cognitive and overall health. And as this says, consistency over perfection. You don't have to do everything, but try to do something every day. These are my references. These are my collaborators. Thank you, Mindy, again, and Yoga Moves MS for inviting me to speak. And I'll share this, but I've had the opportunity to be involved in some op-ed commentary over the last about 2 years. So these are those links. So if you would like, I can share this. But thank you so much. And I see that we're eating already. So any questions?
Does having an autoimmune disease like Crohn's, colitis, Crohn's disease, if you have a flare, does that make you more likely to develop or have MS symptoms?
So the question is, if you have an autoimmune disease process, does that potentially lead to a higher likelihood of a flare? Yes, it does. So having an autoimmune disease process indicates that you are more likely to have other autoimmune disease processes or have impact across the board. So if somebody were to come in and you were to say that somebody has Crohn's and you're concerned about MS, and somebody doesn't have Crohn's and you're concerned about MS, there's a higher likelihood that that individual with Crohn's would have it versus somebody that doesn't have an autoimmune disease process already. Anything else? Yes.
Hi there. How do we check our gut health? I know we were just talking about it, but how do we actually check it? And do you recommend like parasite or body cleanses? And what are like the benefits of that? And is it dangerous also if you have MS to do those cleanses?
Specifically for MS, I'm not sure on the body cleanses perspective. One major concern would be if you do a cleanse or a parasite, A, how do you get rid of the parasite? And B, one huge aspect is if somebody gets an infection, say with C. diff, we use an oral medication to get rid of the C. diff, but the concern is actually repopulating the microbiome after you've wiped everything out. So if you do something that causes overgrowth of some bacteria, it may kill off all those other beneficial bacteria. And so you're restarting from the beginning. There are other mechanisms. So fecal transplants, actually, they're fecal transplants. So if somebody were to have their entire microbiome wiped out, they can get transplants. The first goal is going to be trying pre and probiotics for that regrowth. And then otherwise, there are other mechanisms. Checking your microbiome, that can actually be done. So we have a microbiome sub-study within our trial where we send off samples and they get tested for their microbiome. It's not as widely available right now, but I assume it's going to become more widely available as we continue to progress. Well, it's available right now. I just don't know how accessible it is. Yeah. Yeah. Ooh. There's a huge microbiome study happening right now. If you were to look up microbiome studies, there are particular ones right now. There's been a big focus on older populations, think 60 to 79 years old, but I'm sure there's going to be movement into other disease process realms and determining how. For instance, if we want to look at longitudinal data of MS and microbiome, it would have to be individuals that have MS and that we have microbiome. So that would be a next step in this area.
We have another question right here.
Yeah, I'm not sure if you're the right person.
Sure.
But has there been any studies on the environmental impact on the autoimmune diseases?
There has been cohort studies looking at environmental factors, and we think about different air qualities or rural living versus urban living. One study that my colleague in our Alzheimer's Disease Research Center is kicking off is actually wearables where people are being given watches to wear, and it's testing the air quality while they're walking around Chicagoland. And so we'll be looking at how that air quality, and then we'll control for all of our various covariates. We'll look at how the air quality impacts somebody's cognitive health. And then from that perspective, bridging it into multiple sclerosis or other autoimmune diseases, it can be inferred, but I don't know of any in particular randomized controlled trials that have looked at it yet, but Dr. Miravalle may have more info on that.
Is there a way to test for gut dysbiosis?
Yeah, so there is. So looking at your gut microbiome, there is the ability to send off samples. So has anybody seen online the ColoGuard that can be done? It's a home kit that collects a sample, sends it off to look for markers of colon cancer. And so there is the ability to have that done with microbiome. I don't know of any particular companies right now that are doing it, but I know that they exist because we send samples off to be tested.
Okay, so I have two questions. You mentioned a Netflix series, but I didn't catch it. And then do you have an opinion on making your own kombucha?
So Blue Zones is the Netflix series, and it's a series about the individuals that lived the longest in our world. So it's Okinawa, Japan. It's Calagaria, Italy. I forget how to pronounce it. So what is it? Yes, that one. And then making your own kombucha. I think it's fine, as long as you're being cognizant about growth and nothing too robust. You want to have some balance in it. Obviously there's going to be fermentation happening, but yeah, as long as you're being safe about it, that's fine.
Okay, one other question from the chat. What is recommended for probiotic supplements?
Probiotic supplements. So there are little shots that you can take that have colony-forming units in it. Those are really cool, really nice. But otherwise, there are probiotic supplements. I would suggest whole food side of things instead. So having your pickled foods like your kimchi, yogurt, kefir, or doing the kombucha. But supplements aren't bad. It's just a matter of making sure that you're getting the lactobacillus and bifidobacterium, the healthy parts of the microbiome.
Hi, can you comment about sugar and dairy and gluten?
Okay. So we were actually talking about gluten earlier, and if somebody has a gluten allergy like celiac, so that's going to be autoimmune. And if you already have celiac, the ability to throw off some inflammation is going to be higher. From a dairy perspective, low or no fat dairy is where you want to go. I love cheese. I love cheese. But cheese is not healthy for me. The recommended dosing for cheese is like a dye cube size per day. It's not a whole lot. So I like the mouthfeel of it and I like the stringiness and things like that. So my workaround of that has been to get skim mozzarella. So it's a no-fat cheese. It doesn't really taste the same like a wonderful burrata or a fresh mozzarella, but it does give me the mouthfeel and it's no fat. And then the other was sugar. So sugar, refined grains, refined sugar are going to have, they're going to cause huge spikes in your sugar. And that's going to lead to potentially other disease processes, especially if there's a long-term intake. Going for natural sweeteners like honey or monk fruit is going to be important. I actually just spoke on low and no calorie sweeteners, so artificial sweeteners, and those higher intake of low and no calorie sweeteners was associated with a brain age of 1.5 years older than individuals that didn't intake low and no calorie sweeteners. So we're talking aspartame, saccharin, the xylitol, the alcohol, artificial sugars. So trying to lean into reduction of sweetness as well as natural sweeteners is going to be where you want to go with that.
Oh, I heard you mention vitamin D.
Yeah.
B.
Oh, yeah.
Yeah. And I'm really confused about whether there's B12, there's folic acid. I mean,
Yeah, folate. Yep.
There's all these different versions of vitamin B. What do you recommend for people with MS?
So I actually like supplements. I think they're a good way to bridge things. Certainly, if you're eating whole foods, you should be getting all of these nutrients anyway. And then if you're eating whole foods and you're taking supplements, what you're doing is producing really, really expensive urine. But if you're not going to be intaking whole foods, having supplements is great. So to your point, it's multiple B vitamins, B1 through B12. And so doing a B complex multivitamin would be ideal. But if you're going to do supplements, make sure that you're getting them from a reputable source, and no fillers, things like that. And one quick thing, because we were discussing this earlier, I love low-hanging fruit, like what I can do the easiest way, because it makes me do it longer. And we were talking about leafy greens and berries, and obviously I talked about that today. The way I do my leafy greens and berries is I go to Jewel and I get a cherries, berries, and kale mix from the frozen food section. I take a handful of that, throw it in my NutriBullet, blend it up. It's already blended, so it's easily digested. I get my berries. I get my dark leafy greens. I have the cherry that has some tart to cut through the dullness, earthiness of the kale. And that really, really helps me. And so other ways that I've done it is I'll go out and buy my own berries, buy my own cherries, and make my own mixes with spinach or kale or arugula, depending upon how I'm feeling. So, figuring out what works for you, what helps you maintain your modification the easiest and longest is what's important. And also know that there's going to be missteps along the way. Nobody's going to be perfect all the time. But again, it's consistency. Try to do something every day. You don't need to do everything. So, all right. Thank you so much for your time.
Was that amazing? Yeah, second. Thank you so much. So we are going to have a little break. These are like little yoga commercials, and I hope you'll do a little bit of these practices together with me. You know her. Oh, I think we have a Detroiter in the room. So I put life in parentheses with MS because life is a balance act. And really, life is all about balance. And then, I'm a little biased, but yoga is all about life. People don't realize that yoga is more than the movement. It's actually a lifestyle practice. And so this is one of my students, balancing a block on her head. Does anybody want to try in person here? Because I've got 3 blocks. If you want to try, okay. All right, you go for it. Yay. Anybody else? I got 2 more blocks. So doesn't mean you have to stand on your head or anything, but you could put a block on your head. All right, you go for it. I don't know. That could be tough on a hat. I see you peeping over there. I'm looking at you. All right. So, to re-emphasize that, or to make known that yoga, you see yoga in the magazines and you think, oh, I got to do all these crazy poses and they have to be done on a yoga mat, but they can be done in a chair. I call it balance. We're looking at balance today. This is our infomercial practice commercial for yoga in 3D, in 3 dimensions. So yoga can be done in a chair, it can be done on the mat, and it can be done standing with a block on your head. So these are all pictures of my students. Real people, right? Real people. Every single one of them in this has MS. So anybody can do this, right? All right, so balance involves 3 systems that we have. One of them is the visual system, and our balance is altered by our vision, our sight. So if you close, oh, look, she's balancing the block on the hat. There's all kinds of balance. And that's what's amazing, by the way, about adaptive yoga is the people in the room, the people in the space, you make it. Like, you come up with ideas. I've been doing this for over 2 decades, and still people come up with ideas I haven't seen before. So we also have the inner ear, or the vestibular system, that impacts our balance, and proprioception, which is a fancy word for our awareness of the space around us. And there's actually another fancy word called interoception, which is the space inside of us. So the ones that yoga can help out with is proprioception and interoception. That's the awareness inside you and around you. So when we practice yoga or some type of mindful movement, I love how the block is being passed around here. This is amazing. We can actually improve our balance, and we can play with sight, by the way. Like, we can play with, like, do I dare you to close your eyes with that block on your head? You know, oh, she took the dare. Oh my goodness, she took the dare. And how is that? It's different, isn't it? It's a lot harder when your eyes are closed. So someone who has impaired vision with a condition like NMOSD or MS or whatever it may be, their balance is going to be compromised, but that doesn't mean that we can't work on it. So the message that I want you to, if I have one message with this balance infomercial, there goes Dr. Miravelli. Oh, you passed it on. I saw that. I thought you were going to do it. Oh, come on. And we got the namaste going with it. So it is possible to improve your balance. And doing silly things like putting blocks on your head or standing on a block actually is providing you with practice so that your balance can improve. Like, no joke, you can improve your balance. So a few things we want to do when we practice balance is we want to breathe, right? We talked about that a little bit earlier, but we want to consciously, mindfully breathe, because once you stop that, the block's going to drop. We want to use props such as a chair when you're practicing balance. You can see in this picture, Terry's using a chair to practice her balance, right? And that's not a sign of weakness, by the way. That's a sign of strength and smarts, using the chair to help with her balance. So we want to vary it up. You want to play with different ways of standing or sitting or on the mat. we add gradual challenges in. So you start by balancing the block on your head, and then maybe you close your eyes, and maybe you pick up a toe or two. We have to let go of perfection, because the minute we think we're going to be perfect at this, like this is a practice, no matter what type of yoga it is, it's considered a practice. It's not black and white, and it's not success or failure. It's not yes or no. It is yin and yang. And you could practice something at 7 in the morning and at 7 at night, and it could be completely different. And it can be based on so many things. What happened before, what's on your mind, what's going on. So that goes along with, we want to practice non-judgment, which again is a practice, because the first thing we want to do is judge ourselves. So before we go on with our next presentation, let's just try, wherever you're at, to practice a little bit of balance and movement. Those of you who might be eating, maybe let that go for a minute. And if you're seated, go ahead and sit and find the center of your sitting bones. But if you'd like to stand, we'd love for you to stand. Go for it. Stand. So whatever is accessible for you. You can stand with a book or a block on your head, or you can sit. So no matter whether you're seated or you're standing, feel your roots. So your roots, when you're standing, are your feet. You're sensing your feet. And I know with MS, sometimes we don't feel our feet, right? But there's still a sensation that's there. So if you, and to be safe, you could use a wall near you, a table near you, a chair near you, but perhaps rock back and forth a little bit forward and back, and see how you feel your balance shift. Feel the weight in your feet. Now, if you're seated, you can rock your sitting bones forward and back. Those are these little bones right at the bottom. They're called I love saying this, ischial tuberosities, because, just to impress you. But you're sitting on your ischial tuberosities, and you can rock forward and back on them. What happens, whether you're rocking on your feet or on your sitting bones, is there's a midway point. If you take all the way forward in your ischial tuberosities, so your sitting bones, or in your feet, what happens to the rest of your body? Just notice it. What happens? And then go ahead and rock back. Rock back. What happens? For me, I notice my core shifts on, right? So your center starts to pull in, your body activates. When we go forward, the spine kind of goes forward, and then the shoulders go forward, and the head goes forward. And guess what? This head weighs a lot. I think the average is 10 to 12 pounds. That's a lot of weight for a head going forward. That will knock our balance off. So if we go back to our center, and just to play for a minute here, how about lift some toes or a foot up? So you can do this seated as well, lifting maybe your knee up towards you. It might not go super high, or, right? So you're holding onto a chair. Notice the weight in your feet. You're on one leg, or you're still on your sitting bones, right? But it shifts. Now, if you're seated, go ahead maybe and take one arm out to the side. The opposite arm is the leg. So if you're lifting your right knee, take your left arm out to the side while you're seated. That very often is testing your balance, right? Seated, I have students, sitting in a chair is an act of balance. So standing now, if you didn't take your foot down, go ahead and take it down and just let it go, and maybe shake out and maybe sway side to side just to let any jitteries out. And we'll go to the other side. So balance is very different from one side to the other. And by the way, none of this good side, bad side, right? We're practicing balance. So now we're going to go to the other side. So now shift your weight to the other leg. And if you're seated, lift your opposite knee that you were lifting before. And then when you're ready, maybe take the opposite arm out to the side. So this might be left knee, right arm. If you're standing, you can do the same thing. Try lifting the opposite leg. Now, maybe both hands are on the chair or a table, or you're against a wall when you're practicing, right? Walls are yoga props. We'll use anything for a yoga prop. So, and then, if it feels safe to you, you might close your eyes. You might. And it might be a split second that you close your eyes, right? And then come on out of that. Yes. You guys are amazing. So I know this looks like namaste. It's a hand mudra, but it's also a balance mudra. You are literally, when you put your hands together like this, you are activating the right and left hemispheres of your brain. You know, sometimes you see people kind of do this, right? You're talking to them and they look at you and they've got their hands together, and it happens kind of naturally. And it's a way to come into your center. Another way to play with is to press your fingers into each other like this. This is also a hand mudra. So by the way, there's hand mudras, there's body mudras. Mudra just means a position. So when you're pushing your fingertips together like this, you are playing with your balance. It literally is a balance mudra. And the energy in your body is shifting by pushing your fingertips into each other. You could take a few breaths here, right here, seated or standing, and you are playing with your balance. And you are helping improve your balance. And if you ever feel like you're feeling a little bit rocky, you could do this with your hands. Press the fingers together, or even take fingertips together like this. It will shift your balance. Yes, this is also a yoga mudra. So thank you so much. This was your yoga infomercial in between our amazing speakers this evening.
So while we're waiting for questions, I just want to bring up a good point. So, one of the fears as we get older, and for those of you my age and above, the thing we all worry about is falling and breaking a hip. Because as we get older, as Minnie said, our proprioceptive sensations tend to diminish. Vision starts to dim. We don't do as well in dark light. We fall, we break a hip, and we help the orthopedic surgeons. So your best guide, your best hope at avoiding that is working on your balance. Again, no matter how old you are, young or old, there's a lot you can do to improve your balance. So, this isn't just about exercise. It's helping you to manage and navigate as you get older. So keep that in mind. And one last thing before I introduce our next speaker, about the B12 question. Remember, too, how I said autoimmune diseases attack anything. You can get low B12 because of an autoimmune disorder that attacks the binding protein that binds up the B12 in your stomach, so you don't absorb it. You can eat all the B12 in the world you want. You won't get B12 into your system. So if you're struggling to get your B12 level up, ask your doctor about checking for that autoimmune syndrome. It's antibodies to a thing called intrinsic factor. All right. Any questions then yes, there's a question here.
Hi there. I have a question when you were presenting earlier. Is that okay?
Yes.
You said that the B cells were the most effective to date. I'm wondering why that is. And then my second question is, you mentioned functional electrical stimulation, and what is that?
Sure. So the B cell class of therapies right now is probably the most utilized therapy. They have very high potency, pretty good safety record. So yes, it's become probably it is the number one class of medication used out there. So just pure and simple, it's considered high potency therapy with a decent safety profile. Right. So the question is, if you don't do well in that B cell class therapy, well, again, good news is you got 20 some other medicines to pick from. So there are all the medicines, have different methods of altering and modifying your immune system. So that's why we have more to work with. We can tailor fit the therapy to the person based upon their preference, their response level. So yes, you've got options. When beta seron came out, now 30 years ago, take it or leave it, that was all we have. You now got close to 30 medications. So yes, if you don't do well with one, it's not the end of the world. We can shift things around. Functional electrical stimulation, uses a system of implanted electrodes to help coordinate electrical stimulation of your muscles to help facilitate movement in a weak or paralyzed limb. So it's still, it's a work in progress still, but it can be beneficial to some folks, and people are doing studies on that. Okay, well, we'll now move on. Dr. Holland, thank you. It was very much good food for thought in your presentation. Our next speaker is Dr. Augusto Miravalli, who is the chief of the Division of Multiple Sclerosis and Neuroimmunology. He is an associate professor of neurology in the Department of Neurological Sciences at Rush University. He is board certified in neurology and subspecializes in MS and neuroimmunology. Dr. Miravalli received his medical degree from the University of La Plata, Argentina. He completed his residency in neurology at Loyola University here in Chicago, where he served as chief resident of education, and then subsequently went on to do a neuroimmunology fellowship at Harvard University in Boston, followed by a fellowship in medical education at the University of Rochester in New York. Dr. Miravalli is the recipient of the 2012 American Neurologic Association's Medical Education Fellowship Award, the 2015 American Academy of Neurology Research and Education Award, the 2015 American Board of Psychiatry and Neurology Faculty Education Innovation Award. He has been involved in both clinical and science-based research in the field of MS and neuroimmunology. He is a member of many professional societies and advisory boards. He is frequently invited to speak at national and international meetings. He's published numerous articles and serves as a consultant to various scientific organizations. We are extremely honored to have him here tonight. This is a huge privilege for us. He is going to speak on the topic of brain health in MS, new frontiers in patient care. So, Dr. Miravalli, we thank you so much for taking time out of your schedule to speak to us.
Very good. Thank you for that wonderful introduction. Thank you for inviting me, Mindy Eisenberg, to this wonderful event. It's great to see the energy in the room. For those of you who are joining us online, the room is packed full with people with great energy. So hopefully you can also sense some of that from your homes. So today I'm going to be brief, but hopefully impactful, because the topic of brain health is something that I hope everyone leaves today with some ideas on how to improve your brain health step by step. So we're going to talk about what are the current recommendations for brain health interventions in multiple sclerosis, discuss briefly the scientific evidence behind the importance of promoting lifestyle interventions in MS, and then I'm going to briefly discuss what we are doing at Rush by incorporating a comprehensive brain health program into the care of our MS patients. Let's start with the definition, and we are fortunate that the American Academy of Neurology took the initiative to actually come together and define brain health. And what I like about this definition is that it tells us that it's a continuous state. It's something that you never graduate from having brain health. It's something that every day you can do something to maintain or to attain the maximal function of the brain to support the most important functions, which is physical, mental, and social well-being. And the last portion of the definition is what I like the most, which is through every stage of life. So you're never too young and you're never too old to start doing something to promote your brain health. So this is a nice definition. And with that, we also know that what are the components that constitute those activities or functions in life that we can do to promote brain health. And you have them listed here. Some of those were already discussed before, which has to do with diet, nutrition, physical activity, but also blood pressure, vascular risk factors, control your weight, control all of those comorbidities, cholesterol that actually may negatively impact your brain health. Trauma, and that has to do with stress, whether it's chronic or acute stress, minimizing negative exposures. Of course, we all know about smoking and the risk that smoking brings to us. But we are learning a lot about alcohol. And I always say that now alcohol is the next smoking. The more we learn about the negative effects of alcohol in our brain health, the more we will realize that perhaps we've been overdoing in terms of alcohol in our diet, and perhaps we need to scale it back. Of course, social factors and structural determinants of health. A passion of mine is helping everyone, including marginalized populations, access health care. And we know that unfortunately there are systemic barriers that actually prevent individuals for certain groups, particularly targeting racial groups and minority groups, to access proper health care. So I think access to health care is equally important for everyone to be able to maximize brain health. And of course, sleep. Our brain cleans all of the inflammation, all of these processes that are occurring that is causing negative effects on the brain during sleep. So we have to have a proper continuous amount of sleep. So let's start with the recommendations that came more specific to MS patients. The first one has to do with early treatment with appropriate disease-modifying therapies. Dr. Bocci just mentioned that we have so many options, and I think those options have to be personalized and has to be discussed with our patients. This is briefly just to bring us all up to speed. You've seen this before. We know that multiple sclerosis causes relapses. Those relapses are represented here with these light blue bars. And we know that over time, the relapse rate reduction happens as a consequence of age. We also know that MS causes lesions, and those lesions may be asymptomatic or not causing symptoms early on in the disease. So these are the two outcomes that our medications are very effective at preventing. We're talking about a rate of efficacy close to 97% reduction in the likelihood of having new lesions or relapses. So this is a wonderful outcome that we achieved in collaboration with our wonderful sponsors in industry to help us develop these medications. However, we know that the second and perhaps most, I'm going to skip through these ones just in an interest of time. The second phase of multiple sclerosis has to do with progression. And that progression is clinically defined as that slow decline in neurological function that occurs at least for 6 months and is not explained by deconditioning or lack of physical activity. Let me give you an example. Progression will be someone that tells me, well, I'm doing well, but I've noticed that in the last year, my right foot is a little bit weak. And in the past, I was able to walk for 2 miles, and now I can only walk for maybe 50 feet to 100 feet. So that will be an example of progression, something that is sustained, something that is progressive, and something that is actually usually leads to a loss of function or disability. And unfortunately, we don't have therapies that are very effective at decreasing the likelihood of progression. To some degree, the therapies will impact progression, but it's a modest effect on progression. And just to make things a little bit more complicated, on top of progressing MS, also age plays a factor into making all of these outcomes perhaps a little more difficult, whether it is cognitive decline, difficulty with memory, attention, concentration, and fatigue. So how do we fix all of this? How do we make sure that our patients, not only we can prevent relapses, we can prevent lesions, but also we can maximize in the ability of the brain to minimize progression and improve function? Well, the good news, and it was mentioned before earlier in the talk, is that the brain is very plastic. The brain is one of those organs that actually can adapt and can change, particularly when facing difficulties. In this case, will be inflammation. And we have what is called a neurological reserve. And that's kind of like your savings account in the bank, right? So that will be the amount of brain that perhaps you're not using today, but you have as a way to back up or to perhaps get engaged into activities that you're going to do in the future. So that neurological reserve is something that we count on as we age, as our brain shrinks as a consequence of aging. We need to use that reserve to continue to do the things we want to do in life. But also we use reserve when we try to do something that is out of the ordinary. Let's say that tomorrow you get inspired and you want to start learning a new language. As you learn this new language, you're going to be using your reserve to try to create a new area in the brain that is now specific to that new language. And that process of developing a new skill in your brain is happening constantly. And it's very plastic, and the brain is going to adapt, the brain is going to change based on the things you choose to do in life. So we can take advantage of that wonderful function of the brain to also improve functions that perhaps we lost as a consequence of multiple sclerosis. So to dive a little bit deeper into brain reserve, we know that there are two types of brain reserve. One that is directly linked to the size of the brain. Some neuropsychologists call that the passive or the brain reserve. And that's something that we can't do much about it. We are born with a certain number of neurons, and we are born with the amount of brain that actually over life we may lose as a consequence of aging. Also, we know that in multiple sclerosis, the rate of atrophy may be a little bit more pronounced. Now we have tools, and it was mentioned before on MRIs, that we can quantify the size of the brain. We can measure brain volume, and we can actually see if our patients have the expected amount of brain volume and how fast or slow that brain volume loss is happening over time. One of the things that perhaps is important to know is that something we can do in multiple sclerosis for brain volume loss is to be on medications to prevent that brain atrophy. And so we know that these highly effective therapies have a significant reduction in the rate of atrophy that is comparable to the atrophy that we see in healthy aging in individuals without multiple sclerosis. But perhaps the area of the brain reserve that is most interesting to understand is what we call the cognitive or active brain reserve. And that will be not just related to the size of the brain, but that's related to how we use the brain. So for a moment, I want you to imagine that the brain is like a computer. So the passive brain reserve will be your hardware, will be the amount of memory that your computer have. And unless you change the computer, there is little you can do. But the active brain reserve will be your software, how many programs you can input into that computer, how rich you can make that computer function depending on what you want to do. So there is a lot we can do with that cognitive or active brain reserve, and lifestyle interventions will have a direct impact on how we actually utilize or maximize that brain reserve. So this is perhaps the area that we can, despite having atrophy, despite having perhaps a brain volume loss that is profound due to multiple sclerosis, we can still do a lot to maximize that brain reserve that we have control on. So what is the evidence that what I'm just telling you is true? So there's a lot of research that actually looked into brain reserve, but perhaps the most impactful is this one. This is a functional MRI. So this is an MRI that perhaps you are not familiar with. The MRIs that you have look at the structure of the brain, but this looks at the function of the brain. And what it does is, as we do certain things, parts of the brain will get activated. And in this study, they had a group of healthy controls, and they asked the healthy controls to tap a finger inside the functional MRI machine. And everything that you can see in orange, red, and yellow, those are the areas of the brain that got activated after tapping a finger. So you can see that this individual activated those red areas by just simply tapping a finger. So what they did is they brought an MS patient of the same age, and they asked the patient to tap a finger. And I'm going to ask Carly, can you tell me, when you compare the healthy control on the top to the MS patient, which one has more red and yellow? The MS patient, exactly. And what is that telling us? What that tells us is that the MS patient, in order to do the same function, had to activate more brain. So let me ask somebody else, this nice gentleman that is here. If you think that a person, in order to do the things they want to do, have to constantly activate more brain, how do you think that brain is going to feel at the end of the day? Fatigued. So this is one of the ways in which we can understand fatigue in multiple sclerosis. You're constantly having to activate more parts of the brain in order to do the things you want to do. And the reason for that is because those pathways that actually have been affected by inflammation are not working the way we want. So one of the ways to actually see that invisible symptom that every patient with MS has, and it's so frustrating when the patients try to tell you, but I'm tired. You cannot see that, but I'm actually exhausted. Or we see it. We can see that, and this is one of the ways in which we can measure that. But I always like to give you good news. So the good news is this. Can we fix this problem? Can we alter the way in which the brain is overly compensating for the things we always want to do? And the answer is always yes. So a follow-up study looked at patients with multiple sclerosis, and they did a baseline functional MRI, and they measured the amount of brain that was activated to perform a motor activity. And you can see here a lot of red, a lot of orange, and a lot of yellow, right? So that was baseline. That was before any type of intervention. So they asked these patients to now enroll into a 3-month program of physical therapy and exercise. And that was not that difficult to do. It was 3 days a week, half hour a day. And after those 3 months of physical activity, they brought the same patients into the same MRI, and they asked them to do the same activity. And what do you see? There is a profound reduction in the amount of brain that was needed in order to accomplish the same task. And what do you think happened to that person's level of fatigue? Significantly decreased. So this is one of the ways in which we can actually alter the way the brain is compensating by actually doing the things we want to do. And consistently, this happens over and over and over every time we try to understand, for example, the benefit of exercise in multiple sclerosis. We know that fatigue, yes, is a problem. And when a patient in front of me tells me I'm tired and I tell them you need to exercise, they look at me thinking, what part of I'm tired you didn't hear? And of course I hear you, but I know that over time, if you exercise, that level of fatigue is going to decrease. We now have guidelines of exercise, how many minutes a week, what type of exercise you should be doing. Those guidelines are going to be revised now because one of the mistakes of the group that developed the guidelines is called them the Canadian guidelines for exercise in MS. And people think that only works for Canadians, but they don't. It works for everyone. And then what happened is that it was a research study that was supported by a grant from the Canadian National MS Society. So the Canadian name went there. But actually that works for everyone. And that guidance tells us is 2.5 hours a week for 6 months. That's the minimum amount of exercise that we need to do in order to get the benefits that we want. Ideally, half of that should be aerobic and the other half should be strength training. As we get older, we should increase the strength training exercise to give more core balance, to give more stability, and also more muscle mass that we usually tend to lose as we get older. So this is just an example of how sophisticated the field of exercise in MS is becoming. There's a lot of science behind that. The one article that I want to point out to you is this. Early on, I told you that the size of the brain, there is little we can do to improve. That's not totally true. There are parts of the central nervous system of the brain that actually we can promote new neurons, something we call neurogenesis. So the creation of new neurons in the brain is possible only in small parts of the brain. One of that is called the hippocampus, and that's our memory center. And there are 2 activities that actually can promote neurogenesis in the hippocampus. One is exercise, and the other one is very related to today's meeting, which is mindfulness. So practicing mindfulness is one of those areas that through stress reduction can promote neurogenesis in the hippocampus. So you're in the right track. You're in the right place today. You're learning something new, and hopefully you're going to incorporate some of this into your life. And just to finish, I'm going to skip into the one area. We don't need to talk about diet. We had a wonderful presentation by Dr. Holland. Just one area, which is how do we implement a comprehensive patient-centered brain health program? And it was mentioned before, we should do better than simply telling people you need to exercise 2.5 hours a week. That's easy for us to say, very difficult for you to do. So what we've done at Rush is we took the initiative to actually have a system and a program that will allow patients not only to learn, but also to change behaviors based on these evidence-based practices. And the brain health program at Rush is being developed to provide these 3 tiers of intervention. So tier 1 is for everyone. You don't have to have MS to benefit from these activities. The tier 1 is community. Tier 1 is entire population of individuals that want to learn more about brain health. Tier 2 will be for MS patients that are stable. So let's say that your MRIs are stable, but you want to learn more about what can I do to proactively prevent disability progression over time. And tier 3 will be for that MS patient that is not doing well, someone that actually we need to do something to act. So in each of these tiers, we have initiatives. We do an annual Brain Health Fair. This is in Colorado. We are hoping to bring that here to Chicago as well. This is for community involvement. We have monthly webinars that happens the second Monday of each month at 6 p.m. Those are free. Those are community-based education. And we call that Conversations on Brain Health. And every month we talk about a different topic related to brain health. You can register for free with that QR code. Tier 2 will be for patients that are stable, that they want to do a little bit more. And for that, we have what we call the Brain Health Masterclass for Multiple Sclerosis. This is a free program. It's a 3-week duration in which in those 3 weeks, patients access over 21 short videos talking about different topics related to multiple sclerosis and brain health. And then they have access to 6 live sessions on Zoom with experts. Dr. Holland is one of those speakers to talk about diet, exercise, nutrition, and other things. And then the tier 3 will be for, and this is just to show you some of the benefits, patients that actually completed this program had a significant improvement in the understanding of brain health, in understanding multidisciplinary care. This is perhaps one of my favorite. 80% of patients became more familiar in distinguishing the difference between MS progression and deconditioning, which is a very critical difference to understand. If you feel that you're getting worse, is that because your MS is progressing or because you need more exercise? So being able to distinguish that is actually critical. Patients like it. We get a 5-star review consistently, and I'm going to continue to brag about it because that's exactly one of the outcomes we want. We want our patients not only to learn, but actually to feel that there are resources out there. There is a community of individuals that are working to make sure that you actually live the best life that you can possibly can. And the third one, I'm going to leave to Adrienne Castillo because she's the lead of this program, which is individuals with multiple sclerosis that perhaps are not doing well. What can we do to have a one-on-one personalized approach to helping individuals implement lifestyle interventions the best way they can? And for that, we developed what is called a brain health clinic. Adrienne is the next speaker. She's going to talk to you a little bit more about the details, but that's a one-of-a-kind resource. Patients have a one-on-one consultation with a nurse practitioner that is certified in the American College of Lifestyle Medicine to talk about all of the different aspects that perhaps we need to work on. So with that, we are hoping that over time, by providing the information, the education, the resources, and the space in the clinic, we can actually help patients have a better life and understand how to start taking the first steps into maximizing their brain health. So in the interest of time, I'm going to stop right here. I'm going to just move to a few of the biomarkers we're using in the research component of the program. It was mentioned before, icometrics. This is a wonderful tool. It's ultimately utilizing AI to quantify outcomes on the traditional conventional MRI. So you can see this individual, everything they see in blue is the cortex, the brain, the gray matter. We can actually quantify brain volumes, we can quantify lesions, and follow that over time in every patient. And over time, we are hoping that with all of these interventions, we can actually help patients walk through the very difficult, challenging path of changing lifestyle. But hopefully today you learn that it's critical, it's very important to truly start changing our diet, the way we live our life, exercise, and other issues that are related to brain health. So I believe I have the last slide to brag about our 7-day access. I mentioned before that access is important. None of these will be beneficial if people can't access these wonderful resources. So at Rush, we took the commitment to have a 7-day access program. What that means is that patients that request a new appointment to see anyone in the MS Center has to be offered an appointment within 7 days of request. Early on, I thought that was going to be an impossible task. And when I joined Rush, I think I became the least favorite division chief in the system because I thought this is going to be our priority. And not only that, every incentive for every member of the MS Center was contingent upon us meeting this metric. So as you can imagine, I was probably the least popular person walking on the hallways. And just to make it even more dramatic, the benchmark that we set to ourselves was 80% compliance. So that means 80% of patients that request an appointment has to be offered within 7 days of request. And you can see the numbers. We finished at 87% compliance for 2 years in a row. So what that means is 87% of patients that called requesting a new appointment with anyone in the clinic was offered an appointment within 7 days. So this is our commitment to make sure that we actually provide this access to anyone and everyone in the community. So with that, what we're hoping to do is this: stop relapses, stop lesions, stop progression, and maximize neurological reserve. So as you can imagine, it takes a village. So many of us are behind all of these wonderful resources. We have 5 fellowship-trained neuroimmunologists. Of course, we have Adrienne Castillo. She's our nurse practitioner, and she's the director for the Brain Health Clinic. Kathy Kiefer is the education manager. She oversees all of the educational resources that we offer to our patients. Jules is the research coordinator. She's collecting research outcomes in every visit. And then we have this wonderful list of collaborators. You already met Tom Holland. He's our expert in microbiome. Monica Diorio is neuropsychologist, and she has developed a neuroresilience clinic, which is a 6-week cognitive stimulation clinic. And Zerfas is a physical therapist that specializes in neuroplasticity and prehabilitation, which is how can we use exercise to prevent not only deterioration, but to improve function. Laura Morris is the daughter of Martha Claire Morris, the person that developed the Mind Diet. And Laura is a professional chef, and she does classes and cooking lessons for patients on how to practically make meals following the Mind Diet. If you join the Conversations on Brain Health, the session in November is going to be Laura Morris explaining how to prepare the holiday meals for Thanksgiving and Christmas following the Mind Diet. So don't miss that chance to meet her. Rob Model is a world-known researcher in exercise in multiple sclerosis, as well as Jennifer Bertrelli, Sheila Dugan, and Clara Takesh. She's our music therapist. So it takes a village, but as you can imagine, we are very proud of that, and we invite you to check our resources. With that, thank you very much, and I'll be happy to answer any questions.
Thank you, Dr. Miravalli. So I'm going to start with a question from online. Here's our question. Doesn't it also mean that if MS patients are working harder, they are getting more brain volume?
No, the volume itself doesn't change when you work harder, but the density of the connections between brain cells does. So the brain cells talk to each other. And the density of the connections between brain cells gets thicker as we use those brain pathways. So yes, there is a volume change, but itself the size of the brain doesn't change with activity.
Comparing primary progressive, secondary progressive, and relapsing remitting MS, is there any differences in how the brain is affected by those types and how they respond to exercise in this?
Great question. The short answer to that question is no, no difference. We are, as a field, we are trying to move away from the distinctions of those clinical phenotypes, even though now insurance companies are forcing us to use those codes. But we're trying not to because we understand that MS is one disease. And most importantly, the benefits of all these interventions are the same regardless of the clinical type of multiple sclerosis.
Any other questions? Right here.
Hi, Dr. Miravalli. If we know that the drugs are supposed to prevent us from getting lesions, and the goal is to not have new symptoms and new lesions, how do we track progression even if there is no lesions or new symptoms? That's number one. And then the second question is, we know that we're on these drugs to not get new lesions. But what if we get new symptoms? Are neurologists concerned just about the new symptoms too, or just the lesions? And I'm trying to take that all in.
Yeah, that's an excellent question. So in general, we measure stability by looking at lesions, relapses, and clinical progression. So that's the basic framework. But sometimes we use certain tests like biomarkers to truly understand other kind of inflammatory markers that are behind the scenes. But in general, symptoms without any progression do not constitute failure to a therapy, right? So in that case, what we do is try to implement symptom management therapies. So the question is, if neurologists are not concerned about new symptoms, if there are no new lesions, well, to some degree it's true. But we still have to address the symptoms. But it's reassuring that there is no evidence of new inflammatory activity.
I have one other question from online. Are RUSH programs accessible to people living in other states?
So some of the program, yes. So what I mentioned before, the tier 1 component, yes, which is conversations on brain health. That's open to anyone and everyone, as well as the tier 2 program, which is the masterclass. So the 3-week program for MS patients, we opened up to anyone in the community, including patients from other states. To date, we have offered that masterclass to over 500 patients, and I think we hit every single state in the United States, including we had a patient from Canada and a patient from Mexico.
What is the relationship between MS and Alzheimer's? How do they end up, yeah.
That's an excellent question and kind of complicated answer, because for decades we thought that MS, in a sense, has an inverse risk of developing Alzheimer's, right? So there is kind of like a lower risk of developing Alzheimer's if someone has multiple sclerosis. Now we are learning that that might not be totally true. And I think part of that is because we are becoming better at diagnosing Alzheimer's disease, both clinically and by certain blood tests. So the recommendation is this. The good news is that all of these brain health activities that help with MS also help to prevent Alzheimer's disease. So while we continue to figure that out, I think that the best you can do is live a healthy life. So that will help you prevent both. But also any concerns, any clinical concerns of memory loss, probably talk to your neurologist, and we can do a screening for Alzheimer's disease as well.
All right, we have one other question right here.
Doctor, thank you so much for all your knowledge and all the participants that have shared such valuable information. Truly appreciate it. My question is in regards to the AI-assisted imaging. For a patient to have that, like a further evaluation, can they bring in an MRI that they've had previously done, or does it have to be taken there at Rush?
Yeah, that's a good question. No, unfortunately, it has to be done at Rush because we had to change the entire protocol in order to be compatible with this program. So unfortunately, if you do the MRIs elsewhere, it's not going to be compatible with this program.
Okay, another question from online. Thoughts on the Octave MS disease activity test?
Yeah, so the Octave is a multi-biomarker panel that is available for patients who wants to get access to certain blood tests and understand kind of like inflammation. There are many different options that we have these days to check for biomarkers. I prefer to minimize the number of tests that I order and truly understand. And related to the microbiome question too, so there are different tests that we can order to check your microbiome. Mayo Clinic has one. There are many commercial ones. I usually would advise patients is like, well, before you engage into a test and you pay for it, we need to know what are we going to do with the result. And for the microbiome, usually what I say, well, if the result is that, yes, perhaps your microbiome is unhealthy, guess what are we going to tell you? you need to eat better. So, one of the challenges of the test is that the outcome usually is going to result in the same advice, which is let's look at your diet, let's improve your probiotics, your prebiotics, try to eat healthy. So I will say at this point, I don't see a lot of clinical utility of checking the microbiome test. I think it's around $400, so it is an expensive test. But of course, it's available if someone wants to check it. The same with the Octave. The question is, what are we going to do with the results?
Could you tell us more about brain fog?
Yeah, so brain fog is common in multiple sclerosis. Also, brain fog is common as a side effect of multiple medications that we often use to treat MS, right? So the medications for pain and spasticity can cause brain fog. So the way we approach the assessment is look at all those factors, understand, what is causing brain fog. Is there any concerns on cognitive decline? And truly diagnose the problem. Is this a side effect of a medication, or this is due to multiple sclerosis? And if we conclude that it's due to multiple sclerosis, the right next step will be a referral to neuropsychology to do more testing, more assessment, and come up with a way in which we can hopefully help patients improve brain fog. So the question is, what will neuropsychologists do? So cognitive behavioral therapy is an intervention that is actually very effective in helping at least address some of the cognitive decline that can happen in MS. So there are different providers doing cognitive behavioral therapy. The program that I mentioned before, we have a 6-week program. And in those 6 weeks, a neuropsychologist will work with patients on techniques to improve processing speed, memory, attention, all of these domains that perhaps are impaired.
Okay, I have one last question from online. Can people come to Rush for periods of time to join programs?
Yeah, so we are open to, as I said before, to anyone and everyone. We have patients coming from other states. So this is something that we would like to offer to as many patients as possible. And also, I would love to see this type of approaches replicating in other centers. So we are working with colleagues in other MS centers to try to bring these programs locally to other regions. So this is something that, we are proud that started here, but we would like to see disseminated in other places as well. Well, thank you very much for your questions.
All right. Was that fantastic? I know there's still questions, so we will get them answered. I promise. I promise. We're just trying to keep on a schedule. All right. So another little yoga infomercial. You've heard so much. Let's take a little break and do a little moving and talking about stretching. But I know there was some talk about strengthening as part of the MS protocol. So I want to give you another hand mudras. These are some of my favorite things to do that comes with strength. So whether you're seated or you want to stand, oops, I don't know where my stretching slides are. Somehow they got moved around, but it doesn't matter because Adrian's are really pretty too. All right. It's okay. So you can sit or you can stand online, people, or you can even lay down if you're online. So the first one is push, if you're seated or standing, push your feet down in the earth like you mean it, right? So this does go back to balance because we're paying attention to our roots first, which are our feet. So now when we push our feet down, notice what you feel in your body. If you're seated, push your feet down, and you have even more work. Push your thighs down like you mean it. So then you'll notice that the lower body is activating, your muscles are contracting, and you probably feel like you want to lift up and out of your waistline and get even taller. So notice it's called this root to rise concept, but a lot of people think of yoga as stretching, fluff, and breath. which is all very important, but so is strengthening. And almost all of these poses and things that we do in yoga can also be very strengthening. There's this whole yin and yang. So as you push your feet down, you can take a break if you were doing it. Push it down again. I tend to talk. So you take a break, you go, oh, she's talking, let it go, and then start again. And how about let's stretch? So take one arm, it's going to be your range of motion, not mine, and lift it towards the sky. Some of us are here, some of us are here, some of us are down here. Lift it as high for your range of motion, and notice what you feel on that side of the body. Lengthen up. But keep pushing down, your hips into the chair, your feet down into the earth. You just got taller. Now let's take a side bend, which, by the way, your arm doesn't need to be up to take a side bend, but people think it does, so we'll go ahead with that. So let's take a side bend now, and you're going to go towards your opposite way, right? So I'm mirroring you. I'm going to the left. Some of you are going to the left, and some are going to the right, and it doesn't matter because we have two sides. Beautiful. I see someone in our in-person audience who is taking the side bend without lifting the arm. That's perfect. Come back up and exhale and lower the arm down. Now take a break and notice how you feel on that one side that you just stretched. Notice the difference. So that's back to that interoception of feeling the sensation in your body. And I know you can't wait. Let's do the other side. So this could be, by the way, a side bend. I'm not lifting my arm. My hand could be at my hip. My hand could be on my shoulder. But we're still getting the benefit of the side bend on the side of the body that's lengthening, right? Is this a strengthening pose at the same time? It certainly can be, because if we don't engage our core, we're going to fall over like a rag doll. So if we pull our belly in and up, oh, I saw that. So when we pull the belly in and up, then all of a sudden, it's a stretch and it's a strengthen in the same time. So come back up. I can't help it. There's so many benefits of yoga. I'm hearing a buzz. Bill, there's a buzz. It's gone. All right. So again, you see these 3 dimensions, stretching in 3 dimensions. You can do it lying down. You can do it seated. You can do it standing. So benefits of stretching. It improves your mobility, it improves your flexibility, of course, and it actually moves around your circulation. So, we can visually see that. Like you can see the color tone or feel it in your body when you move. You feel the circulation moving around. It decreases your risk of injury because you're increasing your range of motion and flexibility. So for a lot of people, stretching helps alleviate pain. And it's not only the physical tension that's trapped in your body, but it's also this whole mind-body connection. It's helping get rid of that mental, emotional stress stuff. So some basic principles for stretching are, we go back to this breath thing again and again, right? Like a broken record. These guys give you all. You've been hearing from our speakers, and you're going to hear from an amazing speaker coming up, Adrian. They are giving you thought for your brain, and you're in your head. So we have to take all that you're learning in your head and put it back in your body. And that's where that whole breath comes in, the whole mindfulness, mind-body connection. So we're going to breathe when we're stretching. That's super important. And that's going to help the stretch. We don't want to do a quick stretch. Now, there's different types of stretching, and there's some guidelines for it. But for those of you who get spasticity, anybody get spasm or spasticity? So when you get a spasm and you're stretching, you don't want to fight the spasm. You want to say, okay, spasm, I'm your friend. I'm going to let this go. Stop the stretch and then start again after you've taken some breaths. But the next time you go back in, you probably want to go back in at maybe a third of the range of motion. It's always better to start slow and start less than you think your range of motion is, because you can always increase it. But whether you have MS or not, if you take it too far, that leads to injury, right? So I always recommend going in slow and maybe a little bit less than you think, because you can always increase the stretch. We use props. We use props for assistance, whether they're chairs, tables, or yoga straps. And people say, when should I stretch? And the answer is, you can do it before or after exercise, or both. It depends on what we're trying to achieve and what you've got going on. There's different types of stretches. You can do a stretch where we just did that side bend. Maybe you go in for a breath or two, you come out, and then you go in again. Or maybe you're doing more of this flowing motion. Everybody do that. Let's take our arms up and just kind of sway side to side. Right? So that's more dynamic. That's more dynamic. Yeah, you guys are really good at this. Let's take the arms down, flow them down. Don't hit anybody near you. If you got somebody near you or a piece of furniture near you, don't hit it. And then, so if some stretches, you're actually you're engaging your muscles before you stretch, which tells your body you're safer to stretch. So that's a really good idea. So I'm like giving you everything you should know about stretching in 2 minutes or less. Precautions are, you want to breathe. If you're in pain, you stop, because we believe it's no pain, all gain. If you start to stretch and it hurts, you need to stop. Now, there's a difference between pain and discomfort. Some people like the feeling of a stretch, and others are like, I don't like that. I don't want to do that. But a slight discomfort is okay. So that's what we're talking about. With the yoga, you help figure out what's going on inside your body, and you don't go past your edge. So with that, I'm going to give you one other stretch that's my favorite before Adrian comes up here. And if you're in a chair, you can move your chair a little bit away from the table. And if you're at home, you could even lie down and do this. But you're going to take your hands and interlace them, or just put your fingers underneath your thigh once you move away from the table, and then kick your leg forward. Now, another option for those of you who are like, my leg is really heavy, you can do a stretch like this. So here we are, we're seated, and you can take the leg forward and stretch it. But the other option is to hold on to the chair, take your legs forward like this, and a lot of you are getting a stretch right here, just doing something like this. That's right. So start with something that's accessible before you go to trying to do the splits. Yeah. All right. That was your yoga infomercial on stretching.
Hi. I have a question about stretching with hypermobility. I was in PT a while back, and she said that stretching too much is not good because of how hypermobile, like, my joints and everything are. Would you say that?
So hypermobility, like I have a really hypermobile elbow. I don't know if you can see that. It's so we do want, that's where when I talked about activating muscles first. So the strategy of activating the muscles before stretching becomes even more important, and not going past your edge. Because a lot of people who are hypermobile, they're hypermobile in one area but tight in another area. So we have to work to find which areas that is. But yeah, I would agree that strengthening is super duper important. Even though a lot of hypermobile people, including myself, love to stretch, we also need to really build in those strengthening moves as well. So we can do it, we just have to do it safely. We want to stay away from stretching at the joint, but more in the middle. We call it the belly of the muscle.
Doing the exercises, does using a mirror help, hinder, or no effect?
I love that question. So in yoga, we usually say the mirror's inside. You don't need a mirror. And so for years, I practiced without a mirror. And most yoga studios do not have a mirror. But then I had a really bad case of sciatica. And I did not know where my body was in space. And I had no idea what I was doing. So now I have a little bit different feeling about that. I think that looking at a mirror every so often is not a bad idea for you to see what's going on. It's more feedback. Do I think you should do it all the time? No, because we want you to feel what's going on in your body. And so we want you to get the messages internally, but vision and seeing is very important as well. So I would say do a sneak peek every so often.
So I've been doing a lot of surrender yoga. And I don't know what I mean, obviously you want us to move. I'm not discounting that, but what do you say about surrender yoga, the slowness of it all, and the mindfulness of it? I heard today the mindfulness is probably good.
Mindfulness is excellent. We have a lot of studies on MS, which Dr. Miravelli talked to you about, that we know that it helps our hippocampus, our memory region of the brain. So yes, I'm not familiar with surrender yoga, but there's different types of yoga that pop up, and it makes me think that that's more restorative or relaxation yoga. Or there's a type of yoga called yin yoga where you're staying in stretches a really long time. You're nodding your head. So if that's the case, I am one for alignment-based yoga. I'm not against these other types. Eclectic is good, but because alignment and posture is so important for so many things, including strength and balance, that's the first priority to me, is alignment, to keep our practitioners safe. Because safety is the first priority to me. Now, if you're really, really tense, like if somebody's having a really stressful day, then the great thing about yoga is you can do a restorative practice. And then if we have somebody who's hypermobile who wants to work on strength, their practice could be on strength. And that's the whole thing. You can tailor the practice to your needs. Yeah.
Okay, one last question.
Restorative yoga is fantastic because, especially for people who experience fatigue, which is a lot, right? I mean, like 80% of people experience fatigue with MS. So restorative yoga will help juice you up again so you can go do something else. By the way, a yoga practice could be one restorative pose. My favorite restorative pose is putting your feet up the wall, or feet like up the baseboard in bed, or up on a chair. That reverses your circulation and helps you to restore. Restorative yoga is extremely powerful, and not enough is known, for the general public about it. So yes to restorative yoga. It is my absolute pleasure to introduce our final speaker, and Adrienne is loved by many. I got the opportunity to get a hug from Adrienne when she came in this evening. And you know how some people have this genuine hug? Adrienne's hug is genuine. So her patients are really, really lucky. I could feel it. I'm like, can I have another one of those? So if you get the chance, you should get a hug from Adrienne. They might be standing in line. So Adrienne Castillo is a family nurse practitioner at the Rush Multiple Sclerosis Center with over 36 years of neuro nursing experience. She is certified as a lifestyle medicine practitioner and heads the Rush Brain Health Clinic. Adrienne thrives in a space where prescribing naps is normal and usual. See, there you go. There's your restorative, and you could do that in a restorative yoga pose. She is passionate about helping people living with MS make necessary lifestyle changes that facilitate best outcomes. In her spare time, Adrienne enjoys practicing a healthy lifestyle. She spends a lot of free time with her 10-year-old granddaughter, Luna, and hopes to role model how to achieve a balanced and healthy lifestyle. So without further ado, now, for those of you online, we will put the handout online from Adrian, and those of you in person have a handout that you can take with you, but not look at now because you're going to listen to Adrian.
Hello, everybody. It's so great to be here with you tonight. I'm very honored. I have to say, this is a very interactive group asking a lot of questions. So guess what? Get ready, because now it's my turn to ask all of you some questions. And we're going to start out. Mindy passed out my handout, and one of the sheets, the top sheet, was about the MIND diet, foods to eat, and then on the back side, foods to avoid. So who can give me a couple of examples from tonight's meal? What foods are compliant with the MIND diet? Just raise your hand. Over here was the fruit. Definitely the fruit. Yes. The vegetables. I saw asparagus, right? Anything else? Salmon. Excellent. Look, you guys are already so knowledgeable about the MIND diet. Yes. The protein, very good. We always want to make sure that the protein is a lean poultry, and keep that serving size to 4 ounces, which is about the size of your hand. So keep the handout out, because we're going to do a lifestyle assessment. I told you I'm going to be asking a lot of questions, and you might want to write down your score for each pillar on, like, maybe the back of it if you have a pen or pencil. I'm already not even using my slides. Okay, so we're talking tonight about lifestyle medicine in practice, assessment, and the 6 pillars. Managing lifestyle in MS matters. The Dr. Miravalli, Dr. Tom Holland definitely touched base on that, but I'll just reiterate why it matters. Reduces symptom severity, improves daily function and quality of life, helps slow progression and reduce relapse frequency, supports mental health, and it builds stress resilience, and mitigates comorbidity risk for other diseases such as hypertension and diabetes. And why does managing your lifestyle and brain health matter? Well, your brain is highly metabolic. It needs a steady flow of great nutrients and restorative sleep, exercise. Lifestyle affects blood flow, inflammation, and neuroplasticity, which is something that Dr. Miravalli touched on. And remember, Dr. Holland talked to us about how your risk of dementia can be lowered when you live a healthy lifestyle, up to 40%. All right, I always tell my patients in my brain health clinic, which, by the way, has been going strong for about 2.5 years, and I've seen 300 patients one-to-one, creating individualized treatment plans, which include making SMART goals and figuring out with each visit how to tweak that treatment plan according to individual needs, barriers, things like that. But so I always tell my patients that You cannot manage something that you don't measure, which is why we do the lifestyle assessment. And this is what I practice every day, and I'm very passionate about it. And it's just, I feel like I've reinvented myself in my career after 36 years of being what you would say was a traditional nurse. And now I get to talk wellness to patients all day long. How refreshing is that? So anyway, I do practice lifestyle medicine, and it's a specialized area of medicine in which lifestyle interventions are prescribed. That's why I said I enjoy prescribing naps, because I do like people taking naps. It is used at the Rush MS Center within the patient care model as an adjunctive treatment for MS, meaning that in addition to maybe your prescribed medication that treats your MS. It's built on 6 key pillars, and it is supported by the American College of Lifestyle Medicine, which means all the guidelines that are used are evidence-based, supported by research. What are the 6 pillars of lifestyle medicine? Number 1, nutrition. 2, exercise and physical activity. Those are 2 different things. Physical activity is more natural movement. Yes, sir. Pardon me? Yes, conditioning. Very good. That salmon's working. Number 3, sleep. 4, stress management / mental health. 5, social connection and sense of purpose. And 6, avoidance of risky substances. Okay, here we go. We're going to do a lifestyle assessment. If you have a piece of paper and a pen or paper, go right ahead, take that out right now. So what we're going to do is we're going to rate each pillar from 1 to 5. 1 is poor, 5 is optimal. I'll ask more than one question for each pillar, so consider the overall score for each pillar and consider your last 2 weeks of life when scoring each of the pillars. Okay, so 1 to 5, 1 is poor, 5 is optimal. Okay, let's start with the first pillar, nutrition. Are you eating more whole foods and less processed food? Have you had at least 3 or more servings of vegetables and fruits daily? Have you had no more than 1 sweetened drink per week? So think about your last 2 weeks. 1 is poor, 5 is optimal. 3 is somewhere in the middle. I'll give you a couple minutes here. Or seconds. Okay, for exercise / physical activity. Have you exercised at a moderate, intense way for greater or equal to 150 minutes in a week, which is 30 minutes 5 times a week? Or could be broken up any way you want. And did you add 2 days of resistance exercises? 5 is optimal, 1 is poor, 3 is somewhere in the middle. Moving on to sleep. Have you averaged 7 to 9 hours per night? Do your daytime naps lasts no longer than 20 minutes. Stress management and mental health. Do you have a go-to stress management technique that you practice consistently? Do you talk to your healthcare provider about your mood, anxiety, or depression, or any other mental health concern? Moving on to purpose and connection. Do you have daily support? Do you have healthy relationships? Does your life have a sense of purpose? Are you engaged in a spiritual practice? Have you spent time in nature? And last, risky substances. Do you avoid alcohol, nicotine, and recreational drugs? And this includes smoking, vaping, e-cigarettes. Yes. Okay, you just hold on. Uh-oh. One sip. He wants to finish it, so it's one drink. Okay, so obviously if you scored 4 to 5s, that's more in the optimal range. You're doing very well, living a healthy lifestyle, maybe have some areas to improve. If you're more in the middle, then there's a little bit more to improve. And then 1 to 2s, there's a lot to improve. So let me move on.
What should be the total range? That's the best range.
5 is optimal. So if you scored 5 on each of the pillars, you would end up with a 30. So just by the way, this isn't the exact assessment that I do in my brain health clinic, but I modified it for the sake of this event, but it's pretty close. All right, let's talk about Pillar 1 nutrition. What are the guidelines? The guidelines say to adopt a brain healthy eating plan. Eat more whole foods that are nutrient dense, not calorie dense, but nutrient dense. Make sure it's an anti-inflammatory eating plan. Avoid processed foods, added sugar, and saturated fats. Remember, empty calories lead to weight gain and fatigue. And added sugar, there is a limit per day. So 25 grams for women, 37 grams for men. I can tell you right now that a can of Coke has about 39 grams of sugar in it. And what are the brain benefits of following the guidelines for nutrition? You're going to improve blood flow, reduce inflammation. You're going to support that gut-brain axis that Dr. Holland talked about. And it's going to support your cognitive abilities. Now, here's some of the nutrition interventions that I prescribe in my brain health clinic, and it mostly revolves around following the MIND diet. It's a high-fiber diet because it's filled with fruits, vegetables, whole grains, beans, and if I also wanted to point out on that handout on the MIND diet, it's a nice sheet to put up on your refrigerator. Use it as a reference. But on the back side of it, food foods to avoid. I think we could have identified a few foods to avoid from the meal tonight, but it's okay. We're starting fresh tomorrow. Remember to stay hydrated. We water our grass. Why not water ourselves? And ensure that your B12 and vitamin D are adequate. And you can ask your healthcare provider to check those levels. Moving on to pillar number 2, exercise and physical activity. I think you know the guidelines from the question, which is strive to get up to 150 minutes of moderate, intense exercise per week and include 2 days of resistance training. Does anyone know what resistance training, an example of resistance training? Lifting weights, yes. The resistance bands, doing squats. And the brain benefits are improves cognition and enhances mood. And then in regards to the benefits of exercise in MS, decreases inflammation, improves balance, improves fatigue. And some of the interventions that are prescribed in my brain health clinic include walking, biking, swimming, dancing, chores. Doing your daily chores count towards physical activity. Do wheelchair exercises, and make sure to count your physical therapy into the minutes per week. Add balance and coordination work. Why not? It will improve things. And make sure, and Mindy said this too, incorporate movement breaks. If you have kind of a sedentary life, here's where you start. You start standing every hour for a few minutes and just get those muscles moving and the blood flowing. And that's where you start on your health journey in regards to exercise. And that's what I love about my brain health clinic, is that I can meet patients where they're at. And this includes discussing any barrier that we work on removing those barriers and starting to make small changes. Okay, our next pillar, which is sleep. The guidelines from the American College of Lifestyle Medicine say 7 to 9 hours nightly. And what happens during those 7 to 9 hours? Your memories are consolidated. Brain waste is cleared and mood gets regulated. Your family will thank you for getting 7 to 9 hours of sleep. So a lot of my, I don't want the laser. My sleep interventions focus on sleep prep and sleep environment. And I know, sleep prep, what the heck is that? Well, we should put some thought into sleep prep because it does matter and make a difference in terms of helping you to have a relaxed body, relaxed enough to be able to fall asleep. And that's the goal of sleep, right? Is to fall asleep. So have a consistent sleep and wake time. Limit your alcohol, nicotine, caffeine, and screens before bedtime. At least 90 minutes prior to when you want to go to bed, put the screens down. The light that's emitted from screens prevents melatonin from being released because your brain thinks it's daytime due to the light. And melatonin is that natural sleep hormone that you need to feel sleepy and fall asleep. Remember, a cool, dark, quiet sleep environment matters. Cool meaning 60 to 67 degree temperature is optimal. Get some dark shades and curtains so that it's completely black, and make sure that it's a quiet sleep environment. Some patients that I work with like to have a little meditative sort of music on throughout the night. You know, that's how they fall asleep. And once again, it's my practice to meet my patients where they're at. And if we could ever make improvements from there, then we will. And we will work on that. And then for chronic sleep disorders such as insomnia or sleep apnea, I'll definitely send you to the sleep medicine doctor where you can get a sleep study. Okay, pillar 4, which is stress management and mental health. The guideline for that is to build stress resilience, which is being able to adapt, and this decreases the risk for chronic stress, which causes all that inflammation to begin with. The brain benefits of being able to manage your stress is that it lowers cortisol, which is a daytime stress hormone. It doesn't belong in our bodies 24 hours a day. It's mostly released during the daytime. Reduces inflammation, improves focus, decision-making, and information processing, those executive functions that we all need. And then stress management interventions for building stress resilience. In my clinic, I often ask patients to have a practice of gratitude. So 5-10 minutes every day, maybe at night as part of your bedtime routine. Write down what you're thankful for. Your brain reward system is activated, and your perspective over practicing this gratitude gets shifted from the negative to the positive. Practice meditation. Often patients say, I'm not into meditation, I can't do it, it's hard. Well, you have to practice it for at least 6 weeks consistently every night, but the benefit of it is that it puts your body into a relaxed state so that you can fall asleep. And so what I often suggest is to get a guided meditation where someone is telling you what to do next. And then you don't have to just sit there in silence and say Om. Find a go-to stress management technique so that when you become anxious or nervous in the moment, you can do it without anyone noticing it, but it helps your inner body to feel calm. So the best thing to do is some breathing technique. I often suggest the inhale for 4 seconds, exhale for 6 seconds, and do this for 3 deep breaths. And that automatically sends signals to the brain. Your heart rate is reduced. The brain no longer perceives a threat. You're in parasympathetic mode and feeling nice and calm. And just if it doesn't help in 3 deep breaths, then do 3 more until you're feeling much better. But I think everyone here can say taking a deep breath really feels good. Nurture a positive view of yourself. So what does that mean? I ask my patients to talk to themselves as if they are talking to their best friend. What would you tell your best friend if they felt like you did? Treat problematic circumstances as if they're learning, as a learning process. Have an opportunity to learn even from problems. Practice acceptance. And once again, enjoy nature. Winter's coming. Bring nature indoors. Maybe go get some plants that you can take care of. Create a space that feels like you're in nature. And otherwise, in good weather, when it's more comfortable to be outside, get out there every day. Pillar 5, social connection and sense of purpose. The guideline is to enhance social connections and decrease loneliness. Loneliness increases the dementia risk. Social connection is as important to a person's vitality as food, shelter, and safety. And the brain benefits of social connection and sense of purpose, it boosts your stress resilience, releases oxytocin, which is considered the love hormone that you get from Adrian's hugs. Instead of Q&A, maybe we'll just hug it out. Promotes emotional and physical well-being. I like that emoji that I just saw. Someone online did that. And social connection interventions. I love the first one because sometimes all it takes is awareness to know that there needs to be a change. So be aware that loneliness, feeling lonely, is a signal that something needs to change. And this too is an area to talk to your healthcare provider about, because certainly feeling lonely, if it's for more than, a little short-term time, is certainly going to impact your mood. And it's important for your healthcare provider, whether it's your primary care, your nurse practitioner, your neurologist, let them know. Build and maintain your relationships. Volunteer. Enjoy nature and other spiritual practices. Consider getting a pet. Pet therapy is real. Take a class, learn something new, and join an in-person or online support group. So what I want to say about that, about support groups, is support groups need to be uplifting, not depressing and sad. So it is perfectly normal that it might take you 3 attempts before you find the right support group. There's plenty of out there. I just got 2 cards on different support groups from a table over there. Find your tribe of people that you feel connected with, that will uplift you, and don't worry about the ones that you didn't feel connected with. Last but not least, Pillar 6, avoidance of risky substances. So the guidelines are to avoid tobacco and recreational drugs. So in other words, if you don't smoke or do drugs, don't start. Limit your alcohol, less than 1 or equal to 1 drink per day for women, and 2 drinks per day for men. And remember that long-term use of benzodiazepines, used often for anxiety, worsens anxiety. And these should be used in a very sparing way, especially maybe just appropriate for MRI sedation. And examples of that category of drugs: Xanax, Ativan, Valium. And the brain benefits of avoiding risky substances includes decreased risk for cognitive impairment. So finally, my summary and my call to action. You know, your brain is the most vital organ, and I can say that because there's not any cardiologists here. But I will tell you that what's good for the heart is good for the brain, and what's good for the brain is also good for the heart. Brain health is definitely influenced by lifestyle choices, and that is why it's important to have a brain healthy life. Make small, consistent changes. Improve by 1% every day. Imagine the impact after 30 days if you follow that. This is not about perfection. It's the smaller the change, the more sustainable it is. And we're interested in making intentions grow into habits that grow into a lifestyle. Every time you eat, move, or rest, you're shaping your brain's future in one way or the other. Thank you so much for your attention. I really appreciate this opportunity. Thank you, Mindy, for allowing me to speak. I love what I do. I hope it came through in what I talked about. It's one of the most rewarding careers that I've ever had. And what a way to finish out my career at Rush is in this role. So Dr. Miravalli, please keep me. I need my job.
Wonderful job, Adrian. Thank you. Does anyone have any questions for Adrian?
Hi, we love you. So when she was talking about support groups, I just want to share an amazing support group that I found. It's called Modified by MS. On Mondays, they have 2 separate groups. They have a men's one that is run by a man living with MS. And then they have a women's one also run by a woman with MS. On Tuesdays, they have a co-ed one. I found it this summer, and it is a positive, uplifting, supportive place. It's called Modified by MS. I think it's .org. Just wanted to pass it along to everyone. But my question for you is, we were talking about sleep as a huge pillar. What if we have a very easy time falling asleep, but we wake up and we're up from like 2 o'clock to 7 o'clock? How do we fix that? Because that's a huge pillar and it sucks.
Right. So that's something that we definitely work on in the Brain Health Center. If after 20 minutes of being awake, you cannot get back to sleep, move out of your bedroom temporarily and go into another room and do something that's maybe boring, like reading. And because the whole object, well, I don't mean that reading is boring. Choose a boring content. You know, so on the Calm app, there's bedtime stories that you could actually listen to, and the content is mundane. The whole purpose of that is to get your body relaxed so that you have the ability to fall back to sleep. I had a patient share a recommendation with me, and that's to whether you're trying to fall asleep or go back to sleep after waking up, count to 150, and you might find yourself with your mind wandering off and thinking about something else, and then you're going to say, oh, wait, I was counting. So go back to where you left off and try again. Keep doing that until you fall asleep. So, of course, I had to try that, and it does work. Is it 100%? No, but it is a strategy.
All right, I have another question from online. My neurologist told me not to take B12 vitamins. Why is B12 controversial or not agreed upon?
I'm not sure the specific reason for that individual. However, if your B12 level was high, maybe it was to get the level back down to normal. I honestly, as long as you're eating healthy, it is the most efficient way to get all your nutrients from the diet, from your food. And that we don't even know from supplements what gets absorbed. So I think it was Dr. Holland who said there's some expensive pee in the morning. But so the first step in regards to B12 is eating sources of food that contain B12.
Okay, so my question is, you under the pillar of sleep, getting 7 to 9 hours, the benefit is the memories are consolidated.
Memory organization occurs during sleep.
Okay, so if somebody consistently gets 6 hours of sleep for 3 months, can they ever get those memories back or ever get those memories organized again? Or is it just brain fog forever?
Yeah. Yeah, I understand what you're asking, and I'm not sure I know how to answer that, so I might need help from my team. Oh, good.
Yeah, so the memory consolidation piece is the memories during the day, the experiences that you live during that day. At night, that's when you consolidate those memories into a long-lasting forming memory, right? So if you sleep 6 hours, it's going to be fine. But I think this recommendation has to do with consistently and uninterrupted sleep. That's actually when you get the benefit. If you're at 6 hours, try to do something to bring it up to 7 to 9 hours. Interestingly, studies looking at more than 9 hours is not better. So there is a limit, is the ceiling effect, right? So don't go beyond 9 hours, don't go below 7.
And I did forget to explain about the 20-minute nap. Everyone was disappointed in that recommendation from me. I got you all worked up, saying that I do prescribe naps, but they are 20 minutes. And it's just so that you don't fall into that deep sleep and then it gets interrupted. And if you've ever woken up from a nap and you feel more tired than when you went down for the nap, that's called sleep inertia. And the purpose of a nap is to refresh you enough so that you can tackle what you have to do the rest of the day. It's not to catch up on sleep or anything like that. So also the 20-minute nap makes sure that you're not going to interfere with nighttime sleep. So you need to be tired in order to fall asleep. And a nap may just prolong you from going to bed at the same time every night.
So you were talking about things to avoid, like medications to avoid. So yesterday I went to a spine doctor and they were saying you should start low dose naltrexone. I've never heard of that. Either, I don't know if you or Dr. Miravalle wants to touch on that, but is that a medication that we want to stay away from? And why are they pushing to prescribe? I've never heard of it till yesterday.
What I know, and I'll ask Dr. Miravalle to address this further, what I know about low-dose naltrexone is that it's for an anti-inflammatory effect and that there's not too much evidence behind it.
I agree. I don't think I have anything else to add. Is that no scientific evidence that low-dose naltrexone helps in multiple sclerosis. And actually, there was quite a lot of research done. There was a lot of effort. At some point, LDN became kind of like that popular intervention that a lot of individuals wanted to know more about. And consistently, the research fell short in showing any measurable benefit of taking LDN.
thank you very much for this opportunity. And I hope you'll take the first step to your new health journey starting tomorrow.
Thank you, Adrian. Do I get another hug? Oh, she gives really good hugs. You should start charging for those. You'd be rich. So it's been my absolute pleasure to be with you today with all these amazing experts, our speakers, the community together. All of you made this possible. We learned so much. And I hope you take away just a few things. As you go to sleep, let your hippocampus and everything in your brain assimilate all the information. This will be available to you, the recording, so don't worry whether you took notes tonight or not. It'll be in our virtual exhibit hall. I want to thank our sponsors again, our top sponsor, TG Therapeutics, our other sponsors, Biogen and Novartis, and our exhibitors. Please be sure to complete the survey that you will receive in your email and follow Yoga Moves MS on all your social media channels. And please join us live online or our free recorded classes. We're all free, donation only, so we hope to see you in our community and help us to become even mightier. So thank you, good night, and namaste.